Good morning, everyone. We welcome you all to the online national seminar. We request all the participants to mark your attendance by filling up the registration form, which has been shared in the form of polls. It is mandatory. We request all the participants to join with your registered email and your registered name as you have registered, so that it is easy for you to mark your attendance and for us also to identify. We'll be starting today's sessions in a minute. Good morning, everyone. We welcome you all to the online national seminar organized by Department of Clinical Psychology on the occasion of World Breastfeeding Week 2026 with the theme Breastfeeding for a Sustainable Start in Life, Strengthen What Works. Organized by Department of Clinical Psychology, Helen Keller Institute of Research and Rehabilitation for Disabled Children, affiliated to Osmania University, Hyderabad, and approved by Rehabilitation Council of India, RCN, New Delhi. Today, this one-day online national seminar is organized in collaboration and association with ApoKOS Rehabilitation Hospital and DHC, Apollo Hospitals, Hyderabad, and also Institute of Human Sciences for Holistic Health, Bangalore, Karnataka, and Aryajanani Trust, Hyderabad. So we thank and express our gratitude to all the resource persons from the esteemed organizations for their consent and their association in organizing this online national seminar today. This online national seminar is being organized on occasion of World Breastfeeding Week 2026, which is organized in first week of August every year. This year, we are commemorating and celebrating it from 1st to 7th of August as part of promotion of health and well-being, because the breastfeeding is the initiation for health and is a foundation of health and sustainable development for human beings. So we are organizing this national seminar today with the theme, the first 1,000 days of life, from conception until child's second birthday. That is 0 to 1,000 days from conception till 2 years, completion of 2 years, which represents one of the most critical periods for human growth, brain development, nutrition, emotional well-being, and lifelong health. Scientific evidence consistently demonstrates that experiences during the window significantly influence cognitive development, immune competence, learning abilities, physical health, and psychosocial outcomes throughout the life. So the World Breastfeeding Week 2026 theme for the year, Breastfeeding for a Sustainable Start in Life and Strengthen What Works, focuses and emphasizes the importance of protecting, promoting, and supporting breastfeeding, as well as an essential public health intervention that contributes to healthier families, stronger communities, and sustainable development. So while optimal nutrition and breastfeeding remain foundational, the first 1,000 days also provide an unparalleled opportunity for early screening, timely diagnosis, early intervention, developmental surveillance, genetic counseling, neurodevelopment monitoring, and rehabilitation services. Identifying developmental risks during infancy enables healthcare professionals and rehabilitation specialists to intervene at the earliest possible stage, substantially improving developmental outcomes and reducing disability. Recognizing the multidisciplinary nature of early childhood, the Department of Clinical Psychology, HKIRRDC, has organized this online national seminar. Today, we have gathered here to bring together experts in neonatology, pediatrics, developmental medicine, genetics, lactation science, clinical psychology, and rehabilitation. This seminar aims to integrate scientific evidence with practical strategies that strengthen maternal and child health services while advancing the Sustainable Development Goals, SDGs, 2015 to 2030. On this occasion, the program will also highlight the current developments in prenatal programming, breastfeeding science, developmental disabilities, human milk banking, genetics, neurodevelopment, and sustainable healthcare practices. The delegates or the participants will gain updated knowledge on evidence-based approaches for early identification, intervention, rehabilitation, and family-centered care. This seminar is expected to benefit psychologists, pediatricians, neonatologists, obstetricians, nurses, physiotherapists, occupational therapists, speech language pathologists, rehabilitation professionals, special educators, researchers, faculty members, students, Anganwadi workers, ASHA workers, public health professionals, social workers, and policy makers, counselors committed to improving maternal health and child health. So today we are organizing this national seminar to promote awareness of the significance of first 1,000 days in lifelong health and development, highlighting the role of breastfeeding in child survival, nutrition, immunity, and sustainable development. Discuss current evidence on prenatal programming and fetal origins of health and disease. Understand the contribution of genetics and genetic counseling in early child development. Emphasize developmental surveillance, early screening, and early diagnosis of neurodevelopmental disorders. Showcase multidisciplinary approaches to early intervention and rehabilitation. Promote awareness of human milk banking and lactation support systems. Encourage collaboration among health professionals, psychologists, rehabilitation experts, and researchers. Strengthen capacity building in maternal and child health services. Contribute towards achieving the Sustainable Development Goals related to health, nutrition, education, and well-being through breastfeeding. So at the end of this seminar, we all are expecting that we will be able to understand the importance of first 1,000 days for lifelong development, apply evidence-based principles of developmental screening and early intervention, appreciate advances in genetics and prenatal programming, recognize the role of breastfeeding in sustainable health and development, strengthen multidisciplinary collaboration for maternal and child care, integrate developmental surveillance into clinical and rehabilitation practice, and various other aspects which today's eminent speakers are going to present on various topics, including we have Dr. Payal Biswasu, who would be presenting on mother's milk to sustainable future, lactation, breastfeeding, human milk banks and network. So we welcome Dr. Payal Biswasu to the seminar. And we also welcome Dr. Anupama Reddy, who would be presenting on fetal programming, prenatal programming, creating an empowered human race. And we also welcome Dr. Deepanjanan Datta. She would be presenting on the genetic blueprint of the first 1,000 days from womb to toddler, and then followed by fourth presentation by Dr. A. Jagdish. We welcome you, sir. He would be presenting on why the first 1,000 days really matter, first 1,000 days of opportunities for early detection and early intervention in neurodevelopmental disabilities. Then we welcome Professor Dr. G. Krishna, sir, who would be presenting on developmental disorders and overview, and then followed by myself, Sri Ravindra, presenting on breastfeeding, a way forward for securing a healthy planet and achieving sustainable development goals, SDGs, then followed by interactive discussion question and answers, and proposing vote of thanks. This would be the schedule for today's national seminar. So we also would like to give instructions to all the participants for the smooth conduction of this national seminar. We'll be muting all the participants. So all the mics will be muted, and you can switch on your videos. We'll enable your videos. And if you have any queries related to the sessions after session, you can unmute yourself. When we open the forum for question and answers, you can raise your hand. We will unmute you one by one. In the meanwhile, while the sessions are going on, or if you have any question, you can use chat box, even at the time of Q&A or when the session is going on. And to avoid any inconvenience to participants, one-to-one messaging is enabled so that whoever is sending messages, that will directly reach the host and the speaker, so that others can continue to enjoy the session and keep learning without disturbance. So don't worry if you are not able to see any messages. We'll be getting your messages directly so that others can continue enjoying the sessions. So we request everyone to stay on for the entire sessions. And we also request all the participants to register yourself through the registration form that has been shared in Zoom polls, that is not accessible outside the Zoom platform, to mark your attendance so that it is easy for us to map your attendance and issue your certificates. And all the certificates will be issued after filling up the feedback form, after verification of your attendance. So I request all the participants to ask only relevant questions related to session, and any other queries can be taken up at the end of the session. Regarding, don't ask if asking for certificate, feedback form, everything in the middle. At the end of all the sessions, we'll be sharing the feedback form, and don't keep messaging for this. And we have provided you the website link from where you can download your certificates after your participation and providing your feedback. So we request all the presenters and also the participants to concentrate on the sessions, on the topics we all have gathered together to disseminate this knowledge, and rest of the things will be taken care by the organizers. So on behalf of the organizing committee, I welcome you all to this online national seminar, and request Dr. G. Sri Krishna sir, Head Department of Clinical Psychology, to welcome you all to this national seminar. Krishna sir, you can unmute yourself, start your video.
Good morning, everyone. On behalf of our Honorable Chairman, Pathan Umar Khan, and from Helen Keller Institute, we welcome all the participants. And today's very, very important topic is Ravindra talked about. It is forming a healthy planet. These 1,000 days of first 1,000 days of any baby makes a remarkable impression on the later life. and especially when the baby is born, when the baby or boy is born. So the healthy attachment, according to John Bowlby, and also Harlock has conducted a lot of experiments in secured attachment, insecure attachments, and also Erickson talked about the psychosocial stages of development, which talks about the early years. Even John Piaget, he also talked about the healthy development, and also Vygotsky. So I'll be talking more when I present on developmental disorders overview. So these 1,000 days are highly crucial for a healthy personality and healthy development of the body. So we know that both are very, very essential for a healthy baby and a healthy planet. We welcome you all and hope you will take a lot of learning from this important seminar. And thank you, Ravindra, for organizing this very, very important and pertinent topic on 1,000 days of first life. I wish you all the best. Over to Ravindra. Ravindra, you're on mute. You're on mute. Unmute yourself.
Yeah. Thank you, sir, for your warm welcome to all the participants and resource persons today. And we have with us our resource persons for the day. We request, to unmute yourself and briefly introduce so that we'll again introduce you at the session. We have Dr. A. Jagdish, sir, from Apollo Hospitals.
Very good morning, Dr. Ravi, Dr. Krishna, sir, and also Helen Keller Institution for organizing this esteemed national seminar on the first 1,000 days, the importance and significance of the first 1,000 days. So today we are going to discuss about the prenatal, perinatal, and postnatal things, and also why the first 1,000 days really matters. Okay, lot of opportunities for early detection and early intervention of the neurodevelopmental disabilities. So I hope the audience will be learning from the faculties. Okay, thank you so much for involving me in this national seminar. Once again, thank you all.
Thank you, Dr. Jagdish, sir, for your consent and your collaboration today. We have Dr. Anupama Reddy Garu. Ma'am, you can briefly address the audience and welcome them.
Good morning. Can you hear me, sir?
Yes, ma'am. We can't see you, but we can hear you.
I think I have to, yeah, let me just do this.
Yeah, now we can see you.
Right. Namaste. Morning.
Yes.
Very nice to be here on this platform. I've been listening to you all for the past 15 minutes or so, where sir was so well elucidating about what the purpose of this program was. And I'm Dr. Anupama Reddy. I'm a pediatrician. I actually am associated with the Ramakrishna Mutt. There's a health center there. So we do it's a charitable dispensary. So we're associated with that. But on this platform, I'm addressing more on behalf of the Arijani Trust as a vice president of the trust. And also we deal with a lot of work on mothers in the expectant stage. So we call them mothers right then and there. And so we are happy to, share our experience and the purpose of this area of interest for us. I would really like to thank Ravindra Garu. Thank you very much for having me on this platform, this whole gamut of specialists in here are the ones that are really required for our children tomorrow. And of course, I thank Dr. Jagdish for thinking me valid enough to be able to present to this gathering. Thank you very much, sir. Thank you.
Thank you, ma'am, for your consent and joining us on this national seminar. We have Dr. Payal Biswasu. Ma'am, you can briefly address the audience and welcome.
Namaste, everyone, and thank you, Dr. Ravindra, for giving me an opportunity. So I'm very happy and honored to be present among all the respected dignitaries who are supporting breastfeeding. And in this World Breastfeeding 2026, we have the theme like support all. And yes, we need support from all. Yeah, thank you.
Thank you, ma'am, for your warm welcome. So, actually, we have our chairman in a meeting. So, once he joins back, he will be addressing the gathering. So, without taking much time, so it's almost 11. As per the schedule, we will be going with the first presenter today. I once again warmly welcome you all to this national seminar. And with the permission of the chairman, sir, and the head of the department, I would like to now start the proceedings, the technical sessions. Just give me a minute. Before starting, we have another resource person logged in. We'll take her message as well. Yeah, we have with us Dr. Deepanjana Datta. We welcome you, ma'am. We request you to share your message on this occasion briefly, addressing the gathering. You can unmute yourself. Ma'am, you are muted. Yeah, ma'am, we can hear you now.
Hello.
Yes, ma'am.
Hello, hi. I am Dr. Dipanjana Datta. I am a medical geneticist, genetic counselor. So I'm trained as a molecular biologist, and at the Apollo CDC and Calcutta, we do come across a lot of patients with developmental issues. And today, I am grateful to Dr. Jagdish sir for finding me in this panel. This is such an elite panel. And I hope that, we can talk a bit on genetics during my session and have an insight on how, the 1,000 days are so important as far as development is concerned, even genetically, and what are the risk factors and what we can actually do as prevention so that, we can have a brighter future. Thank you so much.
Thank you, ma'am, for accepting our invitation and joining us. So we will be now, we have all the panelists have introduced themselves and shared their valuable message. Now we'll move on to sessions today. So we have first session, which is going to be delivered by Dr. Payal Viswasu, who is a lactation consultant. And also she is heading and the founder of Institute of Human Sciences for Holistic Health, Karnataka, Bangalore. We welcome you, ma'am, for your session. And she is actively, engaged in various programs, and she has conducted, from since last 3 decades, she has been actively working in lactation programs and, maternal health, child health, and she has been working with the international NGOs, and she is also chairing various sessions on maternal and child health in international organizations like Rotary Health, and she has also received various awards for her services. We welcome you, ma'am, on this wonderful occasion to deliver your topic on this occasion of World Breastfeeding Day. We welcome you once again on behalf of the organizing committee to deliver on mother's milk to sustainable future, also focusing on lactation, breastfeeding, human milk banks, and waste networks. Over to you, ma'am. Thank you.
Thank you so much, Ravindra sir.
Thank you.
Very good morning, dignitaries, guests, healthcare professionals, and my dear friends. So from August 1st to 7th, we celebrate World Breastfeeding Week. And this year's theme is breastfeeding for a sustainable start in life and strengthen what works. And it's a privilege to stand before you and, to speak about the subject, which is not only very close to my heart, I think it is central to the health of every nation. Mother's milk to a sustainable future. And when we speak about sustainability, we often think of renewable energy, climate change, clean water, or green cities. Yet we rarely acknowledge the most sustainable, renewable, and life saving resource that nature has gifted humanity is the mother's milk. Breastfeeding is the first investment in human capital. It is the first vaccination, it's the first food, the first bond, and the first act of love. Today, I would like to take you on a journey from a mother's arm to a sustainable system. Every year, nearly 2.3 million newborns die globally. Many of these deaths are preventable. Prematurity, infection, malnutrition, and complications of birth remain major causes. One simple intervention has the power to reduce this risk factor, and that intervention is breastfeeding. So breast milk is not merely a nutrition. It's a living tissue. It contains antibodies, stem cell, immune cell, hormones, enzyme, growth factor, beneficial bacteria, and thousands of bioactive components that science continues to discover till date. No laboratory has ever been able to replicate it. No formula can replace it. Mother's milk is truly nature's masterpiece. And when we talk about breastfeeding, we have to acknowledge it's a public health intervention. When a baby receives breast milk within the first hour of birth, the chances of survival increase significantly. Exclusive breastfeeding for the first 6 months protect infants from pneumonia, diarrhea, obesity, diabetes, allergies, and numerous chronic diseases later in life. And for mothers, breastfeeding reduces the risk of breast cancer, ovarian cancer, type 2 diabetes, hypertension, osteoporosis, and postpartum depression. Breastfeeding is one of the rare interventions that benefits two generations simultaneously. And so, how does breastfeeding contribute to sustainability? Let us look or think beyond the mother and the baby. Breastfeeding requires no factories, no packaging, no transportation, no plastic bottles, no fuel, no electricity, no waste disposal. It produces zero carbon emission, zero industrial waste, zero pollution. It is naturally renewable and environmental friendly. Breastfeeding directly supports the United Nations Sustainable Development Goals by improving health, reducing poverty, promoting gender equality, reducing inequalities, and protecting our planet. Every breastfeeding mother is unknowingly contributing to climate action. However, breastfeeding is not always easy. Many mothers struggle with pain, poor latch, low milk supply, prematurity, maternal illness, returning to work, and lack of family or workplace support. Breastfeeding is natural, but successful breastfeeding often requires education, skilled guidance, and a supportive community. This is where healthcare professionals, lactation consultants, policymakers, employer, and families all play an important role. No mother should ever feel she has to breastfeed alone. And then comes a human milk bank, sharing the gift of life. So, what happens here when a mother cannot provide enough milk? What happens to a baby born at 28 weeks, weighing less than 1 kg? Should should that baby lose the benefit of human milk? The answer is no. This is where human milk banks becomes life-saving. A human milk bank safely collects surplus milk from a healthy breastfeeding mother. The milk is cleaned, pasteurized, tested, stored, and distributed to the vulnerable newborn under strict quality standards. For a premature baby, donor human milk is not simply food, it is medicine. It significantly reduces life-threatening intestinal infections such as necrotizing enterocolitis and improves survival. Every bottle of donor milk carries not only nutrition but also compassion. It represents one mother helping another child she may never meet. This is humanity at its finest. So now what we have to do? One human milk bank cannot serve an entire state or community. We need network that connects hospital, network that connects milk donor, network that connects transport system, network that connects healthcare professionals, network that ensure every vulnerable baby has access to safe donor human milk regardless of where they are born. Our successful human milk bank network depends on collaboration from the government, health institution, professional bodies, NGOs, Rotary, corporate partners, community volunteers. So when everyone's work together, every drop of donated milk reaches the baby who needs it most. So I'm proud to share that through Rotary, being in a Rotary for almost more than 6, 7 years, we have the privilege to establish human milk bank and strengthen breastfeeding awareness in our communities. Our journey has shown us something remarkable. People are willing to help, mothers are willing to donate, communities are willing to support, and all they need is awareness and organized system. When a mother donates such a few hundred milliliters of milk, she may save the life of a premature baby she has never seen. And that is the power of human kindness. And here I will say that every one of us has a role. And you may wonder, what can I do? The answer is just be a little bit, you know, supportive. If you are a healthcare professional, support breastfeeding from birth. If you're an employer, create a breastfeeding friendly environment. If you're a policymaker, strengthen maternity protection. If you are a father, stand beside the mother. If you are a grandparent, encourage instead of criticizing. If you are a community leader, spread awareness. If you are a breastfeeding mother with excess milk, consider becoming a donor. Every action matters. Imagine a future where every maternity hospital has a skilled lactation support. Every premature baby has access to donor human milk. Every workplace supports breastfeeding mothers. Every community understands the importance of human milk. Every family protects the first 1,000 days of life. This future is possible, but only if we build strong system today. Because sustainability is not only about protecting forest, it's about protecting future generation. So I would like to end with a simple thought. A mother's milk nourish one child. A donated mother's milk may save another. A human milk bank saves community. A strong breastfeeding network transforms a nation. And together, they create a healthier, more compassionate, and truly sustainable future. Let us remember supporting mother, saving newborn, sustaining future, because every drop of human milk is more than nutrition. It's a hope, it's a healing, it's humanity, and happy World Breastfeeding Week, and thank you.
Thank you, ma'am, for your insights into the importance of breastfeeding and the breast milk and how it is promoting sustainable development and also health and well-being through environmental and eco-friendly practices, and which is available abundantly. Through collaboration and cooperation, one can support each other, and also in the form of human milk banks, we have the opportunity to support each other for a healthy planet. Now, we have our chairman joined. Just a second. Yeah, we have Professor Patan Umar Khan, sir, who is chairman for Helen Keller Group. Sir, can you unmute yourself and start your video? Sir, we can hear you, sir. We can
Yes.
see you. So, sir is a chairman for Helen Keller Group, and he has almost 6 decades of experience working in disability sector, and he has founded Helen Keller Group. And since then, a lot of professionals have been trained under his guidance and scholarship. So we welcome you, sir, for this national seminar, and we thank you for this opportunity. Kindly address the gathering. Over to you, sir.
Participants and resource persons for this national program, national wide program, and particularly this program is dedicated for young newborn children. From newborn, yes, everyone knows that the first 3 years is very crucial for particularly communication skills to be developed. And see, being a human being, everyone has to be skills to educational stream. So without communication stream, so that is the reason these 1,000 days are very much essential for every human being after birth. So the interaction starts, the receptive skills starts right from birth. The child starts, responding to the world when it comes out from the mother's womb. So that's the crucial time the child starts crying. If the child doesn't cry, the parent starts crying. So that's a very important, the crying, first crying is very important for human being birth. So I appreciate Ravinder and our HODs, Dr. Krishna, for selecting this important segment of intervention. So if we want to have a better intervention and bringing the child to the normal situation, so we need to tap this 1,000 days. 1,000 days are very much crucial for everyone. So I really appreciate all the people, those who are going to be deliver their lecture, and the participants who are participating in this national wide seminar. So I hope with this I will be taking leave, because I am traveling. So that's why I don't wanted to disturb you, and let me my travel goes smooth. Thank you very much, and I wish all the best of this today's program. Thank you, sir. Thank you,
Thank you,
Ravinder.
sir. Thank you, sir, for your valuable message. Your support will always help us to conduct more organization. With your blessings, we will.
Sure.
Thank you, sir.
Bye.
Thank you. So now, with the wonderful message and direction from our chairperson, we shall move on for Q&A, as we have completed the first session. So we request participants who have any queries. You can use chat box, or you can also raise your hand. We can unmute you and ask queries on the first session delivered by Payal Biswasu. Or you can unmute yourself one by one if you are unable to raise your hand. Participants, feel free to unmute yourself and ask queries or share your observations on the first session, which was delivered by Dr. Payal Biswasu, Mother's Milk to Sustainable Future, Lactation, Breastfeeding, Human Milk Banks and Network. Okay, I think it was so lucid that we have no queries. So we thank Dr. Payal Biswasu for joining us on this wonderful occasion and being part of this and being a value addition to this World Breastfeeding Week celebrations and national seminar. Thank you, ma'am, once again for joining us. We look forward for more sessions in the future. And, as well as in the past and future, we also expect the same kind of collaboration for organizing more programs with you and your own. Thank you. So now we will be moving to our next session for the day. We have Dr. Anupama Reddy Garu. She would be talking on fetal programming, prenatal programming, creating an empowered human race. So before starting the session, let me briefly introduce our resource person for the day, Dr. Anupama Reddy Garu. She's an MD. She's an MD in pediatrician from Osmani University. For over 15 years, she worked as a consultant in neonatal department at Fernandez Hospital, Hyderabad, Telangana, where she pioneered the kangaroo mother care and human milk bank projects. She led the organization of a perinatal education program covering topics in obstetrics and neonatology for nurses serving in hospitals across the twin cities of Hyderabad and Secunderabad. She collaborated with grassroots healthcare professionals on helping babies survive initiative of the American Association of Pediatrics. Following her years in the corporate world, she devoted herself to social service and charitable endeavors. Since 2012, she has doing Seva at Vivekananda Health Center, VHC, and currently manages the VHC at Ramakrishna Math, Hyderabad. Dr. Anupama is the secretary of the Arya Janani Trust, a non-profit organization established in 2018 with the goal of consciously nurturing future generations. The organization undertakes various social initiatives such as urban community and rural community outreach programs that addresses the healthcare and well-being of underprivileged communities. Additionally, they also hold national youth contests to disseminate cultural and spiritual awareness among India's youth. Dr. Anupama Reddy has been actively contributing to the global and national platforms on maternal health and prenatal awareness at the Global Prenatal Wellness Summit 2024, organized by the Europe-based Prenatal Alliance. She presented on the science and mystery of the womb and highlighted testimonials from mothers who benefited from Arya Janani workshops, underlining the importance of conscious conception and parenting. With the Rotary Club of Hyderabad, Midtown, she led prenatal awareness training programs for ASHA workers, empowering them with tools to support expect mothers at the grassroots. So in recognition, she received Vocational Excellence Award for consciously nurturing healthy future generations through the Arya Janani initiative. She has been doing a wonderful job through Arya Janani programs. I also attended, personally one program when I met ma'am at Vivekananda Math, Ramakrishna Math. So I also have seen personal witness the wonderful work she's doing, across years, and many mothers have been benefited with this program. So ma'am, we welcome you once again to the national seminar, and thank you and express our gratitude for your consent to deliver today's session on fetal programming, that is prenatal programming, creating an empowered human race. Over to you.
Thank you, sir. Thank you. I'm humbled by that introduction, but I think I should tell my team to reduce the introduction whenever we send it across, because I wish you could just use basic and then go ahead. Thank you very much, sir, for that introduction. And we'll go ahead because I need to share the screen. Actually, we prepared for a presentation for this audience. So if you don't mind, I could share the presentation, sir.
Yes, ma'am. Please, you can go ahead. You have the permission.
Right.
Yeah, we can see the slide.
Yeah.
You can make it full screen if possible.
Yes. Can you see it, sir?
Yes, ma'am.
Yeah. Thank you. Yes, I'll just go ahead because I think we've spoken about this this project and the program also. But just to begin, when I looked at I mean, this is a huge audience for a national online thing on early screening. But when I looked at that, I wondered when our early screening, what is that term that we use as early screening? And do we limit ourselves with birth? So here we can talk about some things where we do not have to limit to the birth of the baby. And these early stimulations, whether positive and whichever way we want to change, can happen actually from intrauterine environment. So here we will learn some things about fetal senses, about the effect of maternal stress, a little bit on epigenetics, because I know we have a genetic expert here, and finally, some experiences of fetal programming. So when we start, we must understand what exactly this is all about. So I'd like to start with a saying from Dr. Thomas Verney, who is a prenatal psychiatrist. And he mentioned in one word where he says, one sentence, where he says, the womb is the child's first world. How he or she experiences it, whether it is friendly or hostile, does create personality and character predispositions and behaviors and all the gamut of things that children do face. So when we want to discuss this subject of the first 1,000 days, of course, we know it starts from conception. But when we say conception, it is actually even before conception, where we say both the mother and the father. When we say mother and father, the moment they think of having a baby. So my reference to a mother and father is from that time onwards. So when the parents want to think also, they have to start with a healthy physical body. That we all know. That is at least about 3 to 4 months before conception, they have to start well. But can we imagine the power of thought and also the power that amongst millions of sperms, one sperm chooses just that one egg which is there. So there's a lot in this subject that we actually do not know. When we look at the baby itself, we know now with a lot of science and experiments and ultrasound investigations that the baby has a lot of senses which they develop. When we start with a sense of touch, we know now that it starts early in the first trimester, almost as early as 8 weeks of pregnancy. Now, by the time the baby is born, we say the baby has 5 million touch receptors on the body. And this baby in the womb can definitely feel a loving stroke of the mother, and also when the mother is a little frightened or emotionally insecure. Next, the pain sensation. When we do a lot of in utero procedures, they have done experiments on whether the baby can feel pain in utero through some of the hormones like the cortisol hormone investigations. And they found that by 13 weeks, there's an active stress fetal axis. And by 27 weeks, the baby can completely feel the sense of pain, which is much more than even a child and an older adult. Sense of taste in the womb, actually the taste structures form by about 12 weeks, and swallowing in the ultrasound we see by the time the baby is 13 weeks inside the womb. So they have used many experiments to clearly show how sentient the baby is inside the womb by these what we call as prenatal and early postnatal flavor bridge. Now in this study, what they did was they gave one group of mothers a lot of carrot juice during the late pregnancy. That means the last trimester of pregnancy. They gave another group of mothers carrot juice during the lactation period. And the third group of mothers did not have any carrot at all. Then later, as we all know, we are dealing with breastfeeding. We all know that for first 6 months, the baby is given exclusive breastfeeding. After that, when the baby is introduced cereal, they actually experimented to see which baby prefers the carrot flavor in the complementary feed. And they clearly could see that the babies who were given carrot during pregnancy and in the early postnatal period, those babies had less negative phases. They enjoyed the food more, and actually they had more food. So with this also, what is thought of is what we call as the implicit memory. That means whatever happens to the baby inside the womb, develops an implicit memory into the subconscious mind of the baby. Why it is important for us to know all this right now is that we know that the baby actually feels and senses everything from the womb and carries forward too. Sense of smell develops by 11 to 15 weeks in utero, and it can feel all the distinctive flavors in the mother's environment. And now when the baby is born, it is born with the taste and smell of the mother's milk, and that is why we see the breast crawl. I would like to show this video on the breast crawl. We can all see the baby is born on the mother's tummy, and then so this you will find that without any help at all, the baby actually crawled up to the mother's tummy, because mother's chest, because the breast milk smells like the amniotic fluid. And this is the basis of early initiation of breastfeeding, for which we have today's breastfeeding week. The sustainable start is with the early initiation of breastfeeding itself. And that sensation is all developed from inside the womb of the baby, of the mother. Now, hearing and listening, we know it develops almost by the mid-pregnancy. The baby can hear the mother's voice first and then the father's voice. This reminds us of the story of Abhimanyu, which we might think is obsolete. But now there are a lot of reports. This is the report of Mr. Boris Brott, who's a musician, and he could keep listening and he could hear a particular music piece well into his adulthood. When he asked his mother what it was, who was also a musician, she spoke to him and told him that that was a music which she used to play while Boris Brott was in the womb and never had a chance to play that particular music piece later in life. So obviously this baby is listening and forming a prenatal memory into whatever is happening. So we know our healthy body has to be maintained for the mother through nutritious food and exercise. But some of the things which will affect the baby in the womb is, what we say is, do not have too many tea, coffee, chocolates, or cool drinks during pregnancy, because they are excess stimulants to the mother, to the baby. Now, we don't mean ban them, but not more than 2 tea or coffee is recommended, because when we say coffee, actually in the mother's body stays for only 4 hours. But in the baby's body, it stays for 4 days. So it's almost the commonest drug which reaches the baby. That is why these recommendations have been made. Now, a father smoking in an environment, or of course, we still don't have any mothers smoking in our country, but even father smoking in front of a mother who's expecting, the baby is like a passive smoker. So they have shown that there is lower IQ levels in those mothers who have a lot of smoke and these kind of things around her during pregnancy. Alcohol is one really well-known thing where now the WHO and American Academy of Pediatrics, the associations, have clearly told us that there is no acceptable amount of alcohol during pregnancy at any part of time, because this alcohol reaches the fetus and it causes later on in life, it causes greater impulsivity, lesser IQ levels, and lesser attention span, lesser cognitive skills. All these things happen with just simple alcohol being taken during pregnancy. We also have pollution. Pollution, in fact, is known to be associated with autism. Pesticides is known to be associated with low IQ. So the way we treat our environment around a mother is very important, is very clear to us now. So for this, apart from the healthy body, of course, the mother has to maintain a healthy mind. And it has been shown by many studies that even listening to soft music, how it helps the mother to calm down and gets a regulatory system in the baby later on in life. So these methods are important for mother to follow. Now we talk a lot of maternal stress. It is there in our environment apart from just maternal spot, but in maternal areas you have mothers who are very emotionally they are liable. So when the mother goes through excess stress, there's an effect on the baby. We see almost 25 to 60% of mothers deliver preterm. And if the babies are born, they can be born with low birth weight. And one more thing which is very important for this group is that these mothers go on to have probably developmental delays in the low birth weight babies. Here it is very clear, when there is maternal stress, the cortisol reaches the baby, and when it reaches the baby, there are intrauterine contractions, and that is the reason for why the baby is born prematurely. There is one more study, which is a large population study, which shows that maternal stress doubles the risk of behavioral problems in the children by the time they are 4 to 7 years of age. Not only that, you see the gamut of things which happen to the baby when there is an exposure to these psychosocial problems for the mother. So it's lower 12-month developmental scores. We know autism, ADHD, attention problems, sleeping problems, eating, and also the reduced telomere length. It does happen with maternal stress, and that shows that the age of the child also comes down. It also sometimes is shown to be associated with schizophrenia. So now the environment, how it affects, I will leave the rest of the thing on genetics to the other genetic expert, but just one or two slides. It says the genes are affected by the environment. This is what we call as epigenetics. And this is very dynamically happens in the first 1,000 days of life. So you do positive influence, that is through good nutrition, there is a positive effect on the baby. If there is negative, like abuse, stress, there is negative effect. And now it is shown that these epigenetic changes are actually inherited also. I've just shown a story of Prahalada there in the mother's womb, whose father, all of us know, is a Asura. But being in Narada Muni's ashrama, Prahalada becomes transformed in the womb. This is the phenomena of epigenetics explained in a mythological way. So this is how grandmaternal stress also follows into the grandchild. So from this, we understand how future generations can be helped and changed by whatever we do. So perinatal mental health is a big problem, like we discussed. Almost 15 to 20% of our mothers have antepartum depression followed to postpartum depression. And there are many ways where they say that this balance is kind of very, very gentle balance has to be maintained. There are a lot of studies which tell us that how maternal stress can affect the mother in the form of preeclampsia, and there's a lot of neonatal morbidity. For example, when they studied on a Hurricane Harvey, they call it, which is a natural disaster on a large population, they found a lot of neonatal morbidities related to maternal exposure to these kind of natural disasters. So it is not possible for every mother to take the support of a psychiatrist, a psychologist who can help them through. When you're talking about the problem as 15 to 20% of our mothers. So this is Trailer et al., who has clearly shown from the Eastern science what all methods can be used to actually decrease and have a better outcome for our mothers and babies through mindfulness, biofeedback, yoga, exercise also is known to help us. These positive hormones, when they happen, they cause nothing else but the prenatal bonding happens. In this, the process of labor, the pain, the normal delivery rates definitely improve. But not only that, the breastfeeding rates improve. And if you really look at it, the extent of that, just like breastfeeding extends into long-term IQ, better cognitive skills, simple prenatal bonding causes a better infant neuronal and later childhood behavioral growth. This is the bonding experiment which they've shown. And here, because we're talking about breastfeeding week, see, there's so much of difference in when you just do a good prenatal bonding during the pregnancy, and even if it helps in decreasing infantile colic. So there is no measurable thing for us to say how much we should concentrate at the right period of time during pregnancy from conception into the first 270 days of the 1,000 days that we're talking about. So from there, we have come to a lot of understanding through modern science. But this is Swami Vivekananda saying in his own words, It is a prenatal influence that gives the impetus for the child to do good or evil. Continues to say, actually, he says, go to 100,000 colleges, read 1,000,000 books, associate yourself with the most learned men of the world. Better off when you're born with the right stamp. This was at a time when William Preyer, a German physiologist, felt that the baby in the womb he's in deep sleep, cannot respond to touch, cannot hear, cannot have any senses. So we have gone a lot forward from there, even in modern science, to explain to us the sentient being the babies in the womb. So with the help of this and in association with the senior monks of Ramakrishna Math, we have formed this program called Arijanani, where we have doctors doing scientific presentations, giving them the knowledge, the youngsters, the knowledge of what should be done in the right way, along with yoga, meditation, singing, storytelling, question and answer sessions. We try to do these workshops together with them. So very clearly, we know the effect of yoga. We all know it decreases a lot of our anxiety, depression. But through pregnancy itself, it is very clearly shown that it improves the pregnancy period. And what I would like to say over here is every minute in the mother's womb, baby is developing 2.5 lakh neuronal cells. So even a minute extra, the baby's development and stimulation and development is much better. Deep relaxation techniques that we teach them actually improve the blood circulation, it improves the bonding, and a lot of other negative effects that the mother has can be eliminated. Now, music is a universal language. Very clearly, like I said before, soft music is what the baby actually enjoys. So, and it also helps in the brain IQ levels of the baby. So this is a small video I'd like to share of a father who used to sing to the baby inside the womb and see how the baby, as a 2-day-old baby, actually responds to his music. So very clearly, these experiments have shown us the effect of early stimulation in the womb and the effect of it in the form of the baby's response to it. Meditation is the best method by which you have deep relaxations, and it causes a lot of emotional regulation for the mother, which will help her to bond with the baby and also makes a character transformation in herself too. So with all this, we have done many workshops, like mentioned. More than 5,000 mothers have come for the offline online workshops. We do ashram programs. Just to share with the audience here, a lot of government programs that are done through ASHA worker training, and thousands of mothers have come through the district programs, the urban outreach with the government. And happy to share by the end of the day the testimonials that our mothers give us, that they suffer from depression, but then the work has helped them to overcome that. And scientific basis actually helps them, how mantras have helped them. So there are multiple number of mothers who have come forward to tell us that these systems have helped them, and how the babies in fact have got transformed into a calm generation itself. With this, what we would like to say is there is a method out. It is not as if there is no method in this process also. That is why we call them as 10 commandments, where through touch, through whatever, eat variety of food, soft music, do only positive media, have a healthy body and mind, completely try your best to avoid maternal stress. The father's role, the society's role is there immensely in this process to support every expectant mother. It is not her job alone. In fact, it is the society around which has to help her, because she is creating the future generations. So give her the harmonious environment, allow her to have emotional and spiritual practices, which will turn out to have fetal programming. These are some videos of our children. This is a 3-year-old child who is winning at the chess competition given by at the state. You can see, sorry. Please see this. She's sitting on 4 chairs. This other baby is a 5-year-old baby, and the grandfather sent this video thanking the team for what the baby is doing. You'll notice what the baby is doing through this video. The baby is able to actually concentrate to meditation at such an early age, which is very difficult for us to see now in our children who are going through behavioral crisis, through many, many issues, which this team here will know much better than what I would probably think of. So we do this work through many workshops, through premarital, pre-pregnancy, and of course the pregnancy workshops itself. I thank you here for everyone to give me this opportunity to present to you all the importance of how a child can start with the brightest beginning. And we would wish that every one of us would join us in this work together. Thank you very much for being here. Thank you. Thank you, sir.
Thank you, ma'am, for the wonderful presentation, and also you gave insights into how traditional knowledge systems has given a wonderful source and inspiration for all of us in maintaining our health, environment, and how to promote sustainable development. And we have, our elders have blessed us, a lot of knowledge, but unfortunately, we are not utilizing it, and we are facing so many issues that we are seeing it today. And you have very well taken up this wonderful project, and also through scientific evidence-based practices, you have been doing research and presenting in academic, conferences, seminars, and so that a great way that you are bringing the traditional knowledge systems back to the mainstream. It's a great work that you have been contributing, and we really appreciate your efforts. And we also would like to collaborate with Janani Trust, Department of Clinical Psychology. We can have collaboration, and we can also work together in coming days. And we once again appreciate your efforts, and thank you, ma'am, for this wonderful session. Now the session is open for question and answers. Participants, you can raise your hand, or you can unmute yourself and share your observations or queries. If any, you can also use chat box or unmute yourself. Chella Hanumantrao garu, unmuted yourself.
Sir, I have one doubt. The comparison between mother's milk, am I audible, sir?
Yes, sir. Please continue.
So comparative, see, some nowadays people are telling mother's milk, people have explained very neatly and cleanly. So comparison between cow milk, mother's milk, and sheep buffalo's milk. So many people telling me that cow milk is better than mother's milk. So cow milk can replace mother's feeding. So out of these 3 milks, whichever is better, and what is the fact behind all these things?
Yeah, ma'am.
Could Dr. Payal, she's the expert here on this panel for that. Would she be able to answer that?
Dr. Payal, ma'am, I think she is not available. But, Dr. Anupama Reddy also is a senior pediatrician, and we have Dr. Deepanjana that also, they are experts in their, even with genetics, and also their experience and my own experience, I can say, whatever nature has bestowed us, that is the best option, and that is the first option. Breast milk is the first option, and there is no at par or anything substitute for that. if there is any inadequacy of supply of breast milk or anything, then the alternative can be thought. But the first preference should always go with the breast milk. That is what I personally suggest, and I rest leave to the panelists for their observations.
Thank you, sir. You're very right. But some added information to whatever you have said. Breast milk, then now we are coming out with human milk banking.
Yes.
So even donor milk is better than cow's milk.
Yes.
Cow's milk is next. It is still an animal milk. But of course, cow milk is also acceptable. But till in fact 6 months, we say no cow milk, in fact, according to science. But sir would have spoken with some other experience of his. But in fact, they call cow milk protein allergy. So we generally speaking, animal milk, we try to avoid at least till a certain age. Thank you, sir.
Yeah, from the genetics point of view, mother's milk is obviously there's no replacement, but there are certain. I'm sorry, I'm getting muted every time, but yeah, what I was saying, there are certain genetic conditions like galactosemia where mother's milk is not indicated. That's the only condition. But otherwise, mother's milk is something that you definitely have to provide. And galactosemia should be tested at birth. In some states of India, we practice newborn screening where galactosemia is screened. But apart from this kind of genetic issue, mother's milk has no other anti-indication as such.
Yeah, so Chella Hanumantrao garu, see, always we all recommend breast milk only. Like now we have alternative like human milk banks, as ma'am also reiterated. Other research Payal, Dr. Payal also reiterated. So we have other option. Earlier also, see, in joint families earlier, we were all like, even the entire village town is also like a family. If there was sufficient, not sufficient milk also with the mother, someone in the neighborhood who were also supporting through breastfeed, right? Now, because of the arrangements of, various occupational and industrial developments, we have been moving to places, and there were, issues in socialization and forming, social relationships. We don't have that kind of bonding. So now, thanks to the collaborative efforts, we are having human milk banks where we can get human breast milk. So that is a wonderful opportunity for everyone. So that is the best source. Always we recommend below 6 months, no other milk other than breast milk is recommended or substituted. So that is for the future of baby. We don't want to compromise on the future of baby. So right. So it's better we always stick to the breast milk. So that's what Chella Hanumantrao. Hope
Yeah, okay. Thank you, sir. Thanks.
Thank you. Anyone else like to share your feedback or observations? There is one message. Safe is yeah. Venkat.
Yeah. Thank you so much for arranging such a wonderful session, sir. And I think my question, I'm late in asking this question, but I just have this doubt. We are talking about the breast milk bank, right? Will colostrum be available in breast milk bank? Colostrum, the very first milk. Can anybody answer that, please?
Yes, ma'am, I would be able to. If Dr. Payal is not here, I think I would probably be able to help with that. So, colostrum, as we know, is the initial milk which comes in within the first 3 days. So, so the thing is, when we are talking about in milk banks, especially if the mother has got a preterm birth, and so what we tell them is, if you can start expressing your milk within a couple of hours after birth, it is possible. Even after the section, it is possible. then
Okay.
in fact that will help in the sustenance of this mother who has a preterm baby, and the baby is actually separated from the mother, because you see continuation of breast milk is based on the baby suckling. So if that is not there, then you at least allow the mother to express her milk very early, within 3 to 4 hours after birth, and then every 3-4 hours, if she expresses that milk, she will also have a good milk let down, and also the colostrum can be preserved for the baby and given to the baby even in NICUs, so that, like Dr. Payal mentioned, it decreases the problems related to necrotizing enterocolitis and all these kind of things. So it does. We can
I can
do colostrum.
Oh, thank you. Thank you so much, ma'am. Thank you.
Thank you, ma'am. We have one more query. Most of the time, a mother's breast milk is not enough, so she starts using formula milk. As a result, the baby stops breastfeeding. In this situation, what should the mother do? By Akila.
Again, because I'm a pediatrician here, if you want, I could answer that, sir.
Yes, ma'am. Please go ahead.
Yeah. So inadequate breast milk is a big question, actually. You see, mother, like we say naturally, even for triplets, she will have enough milk if the chance is given in the right way by our lactation counselors, by our doctors, by our parents who can encourage this mother. So there is the question of inadequate milk itself is questionable, but saying so, it is a lot of mothers face this situation, right? So when they have that first thing, when they have that impression also, I think they should go to a proper lactation counselors, where now there are many like this, where they actually help in re-establishing even if there's a retracted nipple, even if there are other apprehensions the mothers have, lactation counselors really help in that before they actually think it is not adequate at all and go to those methods of starting formula. Even if formula is started, we always say, let the baby suckle on the milk, on the breast. So suckling is the best stimulation for the mother to still have breast milk. When you give all these trials, in spite of that, some mothers do have, that inadequacy. So then they do take the option of formula, and that's what, and at that time also what I would recommend is we do not discourage the mothers, because by then their morale is already quite low. I'm not able to give milk. Even then, if we tell them, okay, formula will give you nutrition, you can still let the baby suckle. Then there's a happening of bonding, those kind of things, and encouragement to the mother happens. So breast milk is not just milk. It is a lot of other things associated with feeding itself. Thank you, sir.
Thank you, ma'am. Yeah, Dr. Shweta.
Yeah. Hello, sir.
Hello. Please go ahead.
Hello, ma'am. I have only one query that was very basic. Actually, in a counseling session, most of the pediatricians are saying this, please feed from the breast 20 minutes from the each breast in one session. So I have this one query. I always told that you have to feed first from one breast till the 45 minutes to 1 hour, so that ki fat content will go to the baby's mouth. But I'm really confused, because मैम ये बहुत बेसिक क्वेश्चन है मेरा. हमेशा हम राउंड पर जाते हैं तो पीडियट्रिशियन हमेशा ये कहते हैं, बिकॉज मैम यू आर आल्सो पीडियट्रिशियन एंड वेरी एक्सपर्ट, दैट्स व्हाई आई जस्ट वांट टू आस्क फ्रॉम यू कि वो हमेशा ही कहते हैं 20-20 मिनट पिलाओ दोनों ब्रेस्ट से. बट इन माई स्टडी एज जो मैंने पढ़ा है इन माई 8-9 years ऑफ करियर इन ब्रेस्ट फीडिंग, कि हम जब मदर की पूरी एक ब्रेस्ट खाली हो जाएगी तब फैट कंटेंट जाएगा, दैट इज हाइंड मिल्क, बेबी का वेट गेन होगा. तो इसका क्या मैम सोल्यूशन है? बिकॉज एवरी टाइम आई टोल्ड देम बट दे आर स्टिल, मतलब पेशेंट को वो यही बता के जाते हैं और जब मैं जाती हूँ तो ये बताती हूँ, तो हमारी जो है ना काउंसलिंग गड़बड़ हो जाती है.
Yeah, you're very right. We may have, the pediatricians who have counseled, they are a little, but once you talk to the mother, your point will be well driven when you can express to them with science also. Like you mentioned, Only one thing, Dr. Shweta, that's only thing, maybe you can go back to your study also, that 45 minutes to 1 hour, there is no 2 hours, 20 minutes like that in breastfeeding. It is just, demand feeding, feed whenever the baby wants, how much ever the baby wants. Similarly, that one breast that you're talking about is let the baby express the milk completely from that breast. It's not 45 minutes, 1 hour. Let the baby express, and then the baby automatically knows that that breast is empty. It's a very sentient being. Then after that, you burp the baby, and or otherwise go to the other breast, because the baby gets off when the baby knows that this baby has actually pumped out all its milk. And you're right about the hind milk. 20 minutes this side, 20 minutes this side, both sides, the baby can get 4 milk, and then you'll have more diarrhea, less weight gain. So with this knowledge also, if you can tell them, I'm sure they will understand you even more than the pediatrician, because a pediatrician doesn't have enough time to spend with the mother, which you may be able to, and that can actually get into more, they'll have more faith in you.
Okay, right. Thank you so much, ma'am.
Thank you, ma'am. We'll take one last question. My wife is a handicap and is suffering from pancreatitis related issues, and the milk is only 10 ml a day for the child. Now the child is 40 days old, so how we can improve this mother's milk? By Dr. Ravi Kiran. Yeah.
Dr. Ravi, sorry to hear about the problems that your wife is facing, but more importantly, I feel so happy with the energy that she's having. In spite of such a problem, she's actually attempting to express her milk, see that there is 10 ml of milk, give that milk to the baby. That is what is more important than anything else over here. So even that little milk will help the baby. But saying so, like the baby must be on formula, but we just discussed, before you give the formula, when the baby is actually hungry, let the baby suckle on the breast. We say the only greatest stimulation for breastfeeding is suckling. When you do that well, you get how much of a milk that you can give. Of course, there are some medicines, there are Ayurvedic medicines, there are some, but more than anything else, the standard teaching is let the baby suckle. The mother will get more milk. So when the baby is hungry, let the baby suckle for some time, and then you give the formula or the express milk that you have. And even if you don't express the milk, if you can keep it and let the baby suckle directly from the breast, if the baby has enough energy to suckle, then you can help the baby that way also. But we all know that once a baby is given formula, they get used to that kind of feeding. So they don't like to suckle on the breast. So again, there's a challenge. So please do not worry about all this. Do your best, which your wife is already doing, and keep it at that. Whatever comes to the baby, that is what the baby will always cherish. Thank you.
Thank you, ma'am. Hope the query is answered. And thank you, ma'am, for your active interaction and also for your valuable inputs, value additions to this national seminar. So we wish you all the success and look forward for more collaboration in upcoming days. Thank you once again. So now we will move on to our next session. So you can keep your queries in the chat box so that we'll take it up after this session. So now we have Dr. Deepanjana Datta. She would be talking on the genetic blueprint of the first 1,000 days from womb to toddler. Before handovering the session, just briefly, let me introduce Dr. Deepanjana Datta. She completed a PhD and PDF from USA, and she is the certified medical geneticist and molecular biologist, PhD in human genetics, postdoctoral in neuromuscular disorders. She is presently consultant genetist, Renew Healthcare Institute of Fetal Medicine, Institute of Child Health, Kolkata, and Apollo Multi-Speciality Hospitals, Manipal Hospitals, Peerless Hospitals, and Neotia Bhagirathi Women and Child Care Hospitals. She is also Secretary, Society for Fetal Medicine, Bengal Chapter, and State Coordinator, Organization for Rare Diseases India, ORDA, and also advisor, Rare Warriors of Bengal, member, American College of Medical Genetics, and also member of IOEC Subcommittee of Genetic Awareness. Her experience and area of interest includes prenatal and reproductive genetics, rare disease diagnosis and advocacy, nephogenetics and neuromuscular disorders, education and policy development in India, genetics and public health. As a PhD student, she has participated in the Indian Genome Variation Database, IGV, has authored several papers, reviewed journals, including PNAS, Kidney International, Journal of Neurosciences, and European Journal of Pediatrics, and Initia First Public Health-based rare disease screening clinics in collaboration with Kolkata Municipal Corporation. And she is also patent holder for diagnostic work in head and neck cancer, focusing on biomarker-based detection and therapeutic targets. So we welcome you, ma'am, once again on behalf of the organizing committee to this national seminar. Over to you, ma'am, for your session.
Hello.
Yes,
thank you so much for that introduction. Very grateful. Can you please give me the rights to share my screen so that...
Yes, ma'am. You can share. Go ahead and share.
It's still not there. It says host disabled. No, I'm doing it from this ID only. Host disabled participant screen share. Can you just... yeah.
Now you can try it, ma'am.
Yeah.
तो ये लड़की ना लड़की सर इसका लेकिन प्रॉब्लम पकड़ में आ गया है क्या आप बैठ सकते हैं जो बीमारी सोचे पार्टनर सिंड्रोम लंबा बीमारी होता है
तो हम लोग यहाँ पे जो डिस्कस करने वाले discuss today is basically the genetic part of the development, and whether we can have these risk factors that we can actually intervene.
I'm sorry to interrupt
here
you.
what we are yeah,
there is some background noise or someone speaking there.
So yeah, that will be. So basically, if we are looking at our first 1,000 days, what we understand is define the 1,000 days is from conception, like I would say before conception, pre-conception, from the time, and then till 2 years. That's what we define as the first 1,000 days. Why this is important? Because during this period, 80% of the brain growth happens, and the neuronal connections, of course, they develop both at conception, and then it grows up till we are born, and our experiences will also make it. But these neuronal cells, or how the brain is developed, will actually need a genetic blueprint. Like it happens because of there are these genes which we know can participate, but that would be your genetic, that's the genetic signature. But what is your genetic potential? Like how much will you ultimately develop will also depend on the gene environment interaction. So you shouldn't confuse a genetic blueprint with the genetic destiny. So say I am a person and I have a potential, like very easy to say that. Like say I'm a person, but if my height potential is say 6 feet, but I'm not given the right nutrition, even if my genes are saying that I am supposed to reach 6 feet, I will not reach 6 feet. So the same is for our neuronal development as well. So my genes can have a potential, but for me to reach that potential is depending on our environment. That depends on the nurture, the emotional security, the stimulations, the learnings, the toxin and the stress and the exposure. So it is basically a dynamic interplay between our genes and the environment. Now, if we just concentrate on the development part, so we know that when a fetus is 3 to 4 weeks, we have the neural tube that forms, and then 4 to 20 weeks, we have the neurogenesis that is happening. And if we move on, there we have 8 to 4 weeks, we have the neuronal migration, then the synapse formation, and this would go from mid gestation to early childhood, early childhood to adolescence. There will be synaptic pruning and myelination. All of this will be deciding my plasticity of the brain. Now, most of these will be coded or looked upon by genetic signaling pathways. But understand, obviously, my exposure and my microenvironment also becomes very important for this precise genetic programming. So the genetic program plus environmental experience will make development, and that is unique symphony that actually would emerge. Now, if we don't understand so much, what we should understand is that it is multifactorial. The neurobiology is multifactorial. There are genes, there are environments. They will actually influence our behavior. So if my genes and environment is not correct, my behavior will not be correct. Now, we talk so much about autism, developmental issues. It is that in most of us, these would be where the problem might arise. So you might have altered neuronal connectivity. There might be a problem in your excitatory and the inhibitory, the neuron. There can be synaptic dysfunction. There can be white matter connectivity issues. There can be sensitive, periods of your brain chemicals being there. In all of this, the crux is the development of the child, how and handle it. And in all of this, the shape of the developing brain will also come out. Now, what are my risk factors? As you know, my previous speakers also had stressed that it is not about the child being born. It starts much before, and I would say you can even add some things also. So if we start, it can be before conception. It can have a advanced stage, if you have some family history, if we can optimize maternal health. All of this will affect, and I will discuss these in details for each of the sections, and this will actually affect how the child is conceived and how the brain of the child works in those, the periods when we are conceiving. Then we are looking at the pregnancy period, maternal infection, nutrition, if there are any toxins, if there is a genetic disorder, if there a placental dysfunction, or if there is a prematurity. All of this will again influence the development. And around birth, again, there can be birth complications, there can be hypoxia, there can be other neonatal illness. All of this will help to understand. Now, if we look at just the genes which are related to autism, obviously there can be syndromic genes, but what if we are looking at genes, like what if we are looking at autism spectrum disorder? In this case, what we talk about it, there are three parts to it. There can be a purely single gene disease, like we have 22,000 genes, something can go wrong in those 2,000 genes which are coding the synapse or, in your brain development responsible for that. It can be epigenetic or it can be completely non-genetic. And sometimes what we know right now, it can be even sometimes more than one genes, and that is what I will elucidate. Now, if we look at this even here, the inherited variants, like, what we can understand even before birth, is about 50%. Now, if this is, I'm taking autism as an example for developmental issue. Now, if you look at it, there can be monogenic causes, there can be oligogenic causes, or there can be polygenic, which means number of genes involved. In most of the cases for monogenic and oligogenic causes, we can do a genetic testing, which is approved right now by the AAP, as the American Association of Pediatrics, as well as the Indian Association of Pediatrics, and also the neurodevelopmental chapter. Now, why this is important? Why even before pregnancy, I'm saying that sometimes we can understand if there is a risk of autism, because, we are in a population where we practice endogamy. That means we marry in the same community or we marry in the same family at certain times. Now, when we do that, there is chance of autism because the gene pool gets enriched, and because of that there can be chances that the mutation also gets enriched, and you have a chance of having a child who has a genetic condition, because the parents are completely normal as they are carriers, but you yield a child who has these both aberrant genes, and the child becomes affected. Now, this is an example of this. See, this is a parent. They have 2 children with Dandy Walker malformation. Both of the children have died. They were never told to test, and when they tested, you see both of them are carriers. Carriers means that we have 2 copies of the same gene, and there is one good copy and bad copy. Both the parents are carrying that, and hence there is a 25% risk, which gives rise to a brain anomaly like this, and this is called a VC syndrome. So this can be easily prevented because we can do an amniocentesis, we can understand for that. We can understand and take account for that. But then is it just genetics? The answer is no. You know, genetics is there, but there can also be other situations which are there, and I will speak on biology. So when you are inside your mother's womb, placental development, which depends on the mitochondria and certain genes over there as well. There can be dysregulation of these placental development. Of course, if the mother consumes alcohol or chemicals or toxins, that will obviously affect the placenta, which will in turn affect the baby. Also, the mother is exposed to virus, bacteria, etc., which can also impact the delivery of the child. Now here we have another example like this. Say it is a 18 weeks fetus who was diagnosed with open spinal bifida, and what happened is carries a mutation in the gene which is responsible for folic acid metabolism, which reduces her capacity to actually accept that. And we know that this folic acid is extremely important, and the ratio of this methionine and folic acid cycle determines the neural tube development. And if there is a problem, then there leads to a global DNA methylation, which can cause aberrant methylation in specific genes. I'm not naming them, but that will affect the pathway and of course will cause these kind of neural tube defects. This is another child. You can see this is a 24-year-old child, a 24-year-old pregnant mother, and she was suffering from anxiety, insomnia. And what happened is that when the child was delivered, had low ApoKOS score and HIE, and had certain feeding and bonding feeding difficulties. Now, you might say that it's a 24-year-old, but you see, she had emotional abuse. Just my previous speaker, Dr. Anupama Reddy ma'am, stressed on this. I will just tell you the pathway also. So when we have this kind of a problem, what happens? The maternal cortisol and cytokine exposure alters our HPA cycle and that causes actually hypermethylation of certain receptors like NR3C1 and BNF, which are responsible for sex regulation. That can actually lead to exaggerated stress reactivity, poor calming, bad neuroplasticity, emotional blunting. So you see, when our elders used to say that keep the woman happy, keep the woman good, it was because of this particular pathway that should not get triggered during the pregnancy, because that will sort of affect the neuronal plasticity. Diet also very important. This diet actually controls the bacteria inside the mother gut. And these bacteria actually secrete something called a short-chain fatty acid. And this short-chain fatty acid controls your acetic, propionate, and butyrate, which actually a factor for your neuronal plasticity. So again, it's about for genetic conditions. These are the inherent conditions which affect development of the brain. Also, there are conditions happening in a child with under control. But inherited variants, which are sorted in the will come and can be prevented if the parents are tested and if they plan their pregnancy. Now, say they did not test during pregnancy. Right now, like earlier, we used to say that all the scans are in the later half of the gestation. But right now, we know that even from 8 weeks, we can actually see fetal anomalies. So from 8 weeks, 12 weeks, 37 weeks, so we now have an inverted pyramid where the detection or the diagnostic capacity is much higher in the, even in the earlier gestations. Now, you can see over here, I have a case where this, you can see there is ventricle trichomegaly, and also there is this case where you can see absent CSP and partial agenesis of corpus callosum. This is just a fetus which is around the gestation of 30 weeks, though this is late, and actually got a 15q deletion. And even now, the government actually lets you decide whether you want to continue this pregnancy or not. And in these cases, if the couple wants, they can actually not go ahead with the pregnancy. Now, you see here, there is another case. You can see this is a binder facies, which means that there is a hypoplasia, macular hypoplasia, and you can see, we can see echogenic kidneys in this case. Here also, because we were suspecting a disorder, we did genetic testing, and here we found a homozygous variation in this particular gene, which causes a condition called the Osmed syndrome. So in these cases, this was detected. But even then, see, after birth, you can see this particular child. This child I saw yesterday only. You can see this child has micronathia and is having feeding difficulties. You can see the overbite. You can see the child has crumpled ears, low set ears. Now, this could have been actually detected or diagnosed in the utero, but they were not. This child was born because they skipped the anomaly scan. And you see here, there is a chromosome 6 deletion that we are seeing. So again, this could have been detected in utero also, but no matter what, we could detect it just right at birth also. About this, if everything is fine, still your baby after birth needs what we call as the newborn screening test, the hearing test, and the cardiac screening test, because these can indicate diseases and diseases that we can actually intervene. Like, we can actually take some actions, and that can help the child in the quality of life. Now, you can see this child is all okay. She's the tallest in her class. She has severe myopia problems, and she has poor scholastic performance also. Now, you would say, okay, go for therapy, etc., etc. But you can do of newborn screening, and here we did a newborn metric screening, and you can see the serum methionine B12 is so raised. This condition called MOCS, and this is treatable actually through methionine. You can see the child is homozygous for the mutation, and the parents were obligate carriers, and this is completely treatable. But again, it was not treated. Why? Because even for treatment, we have to understand that there is a window of treatment. So the earlier we diagnose, we can intervene. And if we intervene, then we will not be able to actually give the effect, the symptoms will itself not develop, and there wouldn't be this life-threatening irreversible disease, but we can actually take care right at the onset of the symptoms. But obviously, if we diagnose here, there is nothing much we can do. So timing, there are about 120 such conditions. If we diagnose them at birth, then we can actually change the course of development and improve the quality of life. But not everything is covered in this newborn screening as well. Now, this is another child you can see comes with profound speech delay, global development delay, social. This is the Griffith score. You can see that it is delayed, and the child was diagnosed with some spectrum disorder. For this particular child, we found mutation in cerebral creatine deficiency. And again, this is an inherited one, could have been prevented. See over here, if this is treatable, this is again a treatable condition. You can see this is you see these MRS peaks for this particular child if you do the MRS spectroscopy, and you can see that this is again a treatable condition. Even the seizures will not develop if we use the right kind of medicine. And this entire complex of development, speech, seizure, behavior, movement, all like if we don't treat, all of this will develop, but if we treat, nothing develops. So again, the timing of treatment is very important. Now, our brain, there are certain single gene diseases that control. There's no mutation, there's no change in the gene, but because of the change in these particular genes, they change the methylation pattern of the gene, and they affect a lot of other genes. So we have these epigenetic carriers, like epigenetic genes, which will act. This is another child. You can see this particular child, like and some dysmorphisms. I'll not go into the detail, but this is another child, but this child only has autism and some learning issues. Now, if you say that, is it that the two have two different kind of genes? The answer is no. They have the same kind of genetic mutation, HKIRRDC1B. Now, you see in the first case, a null mutation, which means the gene is not producing any protein. In the second case, the gene is producing some protein. So the same gene has a region. You can see this is showing the molecular structure of the gene, and you will see that it is reported that the same gene, depending on whether how much of protein is produced, can produce a spectrum of diseases ranging from a syndrome, which we saw in the first case, to simple learning issues, which we saw in the second case. So see, a gene, the type of mutation also decides how we will be able to do it. Now, these we were talking about one gene causing one disease. But right now we know that there are certain developmental conditions or there are certain behavior conditions that can happen because of more than one gene. Now, on your left hand side of the panel, you have genes which is related to schizophrenia. Number of genes, we know it's not one locus, number of genes, and these are the MRS spectrum, as you can see. On your left hand side is a person with autism. And if you look at it, the scatter is more, but you look at the profile of MRS, it also is more or less similar. So there are same kind of genes which might be affected. And all of these genes are actually methylation specific genes, those readers, writers. And you can see over here, the same thing is plotted over here. You can see the parent, you can see the siblings, and you can see the PRS score or the polygenic risk score shifting for the ASD, the autism spectrum disease children. And you can see how these would be affected. And these are all preventable. Here, it's a more detailed one as to, what genes are related to adaptive cognitive issues, language issues, repetitive behavior, behavioral patterns related to polygenic risk scores, ID with intellectual disability, without intellectual disability. So the concept that one gene can affect is also not there. And all of these genes are basically controlled through methylation, hypermethylation or not. Now, this would be my last slide just to summarize. Let's see, we can actually determine something which is preconceptional, the inherited conditions. And when it comes to the fetal life, you can screen, you can have a good diet, you can have a good lifestyle, which will help you for the fetal brain development. At birth, you can do your newborn screening programming, which helps, to at least rule out the metabolic conditions. And then you can also assess the child for sensory integration. And then that is how the more good exposure of the child, it can help in social brain development, emotional development, speech development, and hence the behavior development. But if a child is affected, if you see such a child in the family, genetics is very important, because in most of the cases, you might get an answer. And especially if this family is planning another pregnancy, then it becomes absolutely mandatory. So that would be the end of my presentation. If there are questions.
Thank you, ma'am, for the wonderful insights into genetics. And nowadays it has become very much easier to identify with the development in genetics, and a lot of disabilities or disorders can be prevented in advance if early intervention can be provided in a timely manner with early identification. So now the forum is open for question and answers. Participants, you can unmute yourself or use chat box to share your queries. If there is any difficulty in unmuting yourself, you can raise your hand. We can do it from our end. There is one query. What kind of genetic tests are recommended for screening?
For screening, depending on who you are screening, like if it is the couple or if it is the baby, And we also need to know the history of the child, like if there is any previous, history or not. But normally, the basic screening is couple carrier screening. Like if we want to do preconception, our government also tells us to screen for thalassemia and SMA. And there can be some disease-specific screening depending on the history that is added on. Fragile X should be screened for all women, especially North Indian women, because the incidence of Fragile X is extremely high.
Participants, you can unmute yourself or keep sharing in chat box. There is one more query, ma'am. Yeah. What is your recommendation on premarital genetic counseling? I'm got disconnected.
Hello, I am here. I joined from my phone. I'm here.
Okay, ma'am. Yeah. So there is query on premarital genetic counseling.
So we don't suggest premarital genetic counseling because it would depend actually on the two couples. So these are autosomal recessive condition. If we just test one person, it has no meaning. Whenever you test, you need to test two people. So it is not premarital counseling which is important, but definitely preconception counseling. All right, because if we test everyone, all of us will be carriers of something or the other, and that is not the optimum situation. All over the world, what we follow is definitely preconception counseling, not premarital counseling. Premarital counseling also leads to a lot of discrimination, and as clinicians or healthcare providers, we should definitely avoid that.
Thank you, ma'am. There is one more query, ma'am. Like, is there any genetic test that can determine the breastfeeding issues?
To my knowledge, no, but there are certain genetic conditions related to hypergonadism and stuff like that, which is related to sexual development that might influence. But to my knowledge, we don't have specific genes which are related to breastfeeding, but till now.
Thank you. Okay, any more queries? You can use chat box or you can unmute yourself. Feel free to unmute yourself. If you have any difficulty, you can raise your hand also. Your active participation will help us to understand if you still have any queries. There is one more query. Ma'am, I have a doubt. For example, if a woman acts as a carrier of any genetic abnormalities, is there any possibilities to prevent their offspring from mutation and pass on of this condition to offspring?
Not carriers, but we don't screen for carriers in the fetus. What we can prevent is affected child being born. There are many ways. Number one, we can actually test prenatally at 3 months. We can use the womb, the CVS or the amniotic fluid, which is the fluid around the baby, and test for the specific genetic conditions. Also, there are methods like IVF, PGT-M, where we make embryos from your own egg and own sperm, and then we actually test the embryos. The good embryos are only transferred, and hence here there is no need for abortions, because in the prenatal setup, when we are testing in vivo, like in your womb, we find that the child is affected. We cannot cure the child. You have to go for termination if you want. But in the, that's why this PGT is a method where that termination or abortion is not needed. So this is there, because it is caused by two people also, changing one of the gametes, like either the, then also we can actually have a healthy baby. So you have to go and talk to your geneticist. The geneticist, according to your reports, will help you plan the baby.
I think that's all for this session. Participants, you can keep sharing in chat box. We'll take it up as and when. Right? And thank you, ma'am, once again.
Thank you so much.
Organizing committee for joining us and sparing your valuable time and delivering on the genetic blueprint of the first 1,000 days from womb to toddler. And we wish you all the success and look forward for more sessions and collaborations with you and your organization. Thank you, ma'am, once again.
Thank you so much.
So now we will move on to next session. If you still have any queries, you can keep sharing it in chat box. We will take it up as and when we are opening the Q&A session. And I encourage, we all encourage that you orally ask and give your feedback also. If you don't have questions also, you can share your feedback on the sessions, on speakers also as well. We encourage you all to do so. Now, we have next session by Dr. A. Jagdish sir on why the first 1,000 days really matter and first 1,000 days of opportunities for early detection and early intervention in neurodevelopmental disabilities. Before I hand over the session to Dr. Jagdish, so I will like to briefly introduce Dr. Jagdish sir. Just give me a minute. So Dr. A. Jagdish is a distinguished healthcare professional whose work in developmental health and early intervention has brought hope and meaningful transformation to countless children and families. As the head of the Developmental Health Clinic at Apollo Hospitals, he has dedicated his career to advancing specialized for neurodevelopmental disabilities with remarkable expertise, compassion, and vision. In addition to his clinical practice, Dr. A. Jagdish is actively serving the National Health Mission project under the government of Telangana, contributing significantly to public health initiatives. He is the chief consultant to Government of Telangana and Government of Andhra Pradesh, Department of Education, especially for children with disabilities like autism and other disabilities. A double gold medalist with his academic brilliance is matched by his commitment to professional excellence and community service. His specialized training includes certification as a master trainer in autism tools from pediatric neurology at All India Institute of Medical Sciences, New Delhi, along with certification in early intervention for neurodevelopmental disabilities. His exceptional service earned him a certificate of appreciation from His Holiness Jishnu Dev Verma at Raj Bhavan in 2024 and further recognition from Burra Venkatesha in 2025 for his valuable public service contributions. And also, he received Dr. APJ Abdul Kalam Award for his outstanding contribution in the area developmental pediatrics. And he's also, his principal areas of interest include the crucial first, that is 0 to 1,000 days of early intervention, neuromuscular disorders, and therapeutic developmental programs that can profoundly shape a child's future. His scholarly work, including presentations of papers and posters at national and international conferences, reflect his deep commitment to innovation and evidence-based care. As an active member of leading professional bodies, including the Indian Academy of Pediatrics and the Indian Academy of Cerebral Palsy, Dr. A. Jagdish is also recognized as an international faculty, speaker, resource person in early intervention for neurodevelopmental disabilities. His inspiring journey stands as a shining example of knowledge, service, and heartfelt dedication to child health and human development. I also know personally Dr. A. Jagdish since almost, I think, 2 decades and more. And he's a very down-to-earth, humble person, a compassionate professional who always extends his services by heart and soul and puts his heart and soul into the service. And he truly believes in the profession. So we welcome you, sir, once again to this national seminar. And I now hand over this session to you. Thank you, sir.
Thank you so much, Dr. Ravindra, the chairman of Helen Keller Institute of Disabilities. And also, I'm very thankful and grateful to the other eminent professors, Dr. Anupama Madam, Dr. Biswas, Dr. Deepanjana, and Dr. Krishna, all of you, my dear audience, my friends. Thank you so much for inviting me to this esteemed presentation on the first 1,000 days. I just want to share one video here. Thank you.
The screen is visible, sir. You can make it full screen.
Now, is it okay?
It's still in a...
No.
No, sir, it's not at full screen. Okay, you can continue, sir. No problem.
Now?
Now it's full screen.
This session I am dedicating to my professor, late Dr. P. Sudarshan Reddy. He was the HOD and also ex-superintendent of government Nilofer Hospital, Hyderabad. And these are my appreciation certificates from the Governor of Telangana. This is a certificate of appreciation from His Excellency of Honorable Governor of Telangana, Sri Vishnu Shivarma. And also the Telangana State Public Service Commission Chairman, Burra Venkatesham, IAS. And recently I received award from on the Doctor's Day, that is Dr. APJ Abdul Kalam Award for his excellence, outstanding performance and service in the field of developmental pediatrics. Thank you so much. So this presentation is protected with me and also Apollo Hospitals legally. Now, the actual session. The children's voice, if you look at, we are not the sources of the problems, we are the resources that are needed to solve the problems. We are not expenses, we are the investments. We are the children of the today's world, and despite our different backgrounds, we share a common reality. We are united in our struggle to make the world a better place for all. Every parent think that the child is a burden. Sometimes, it's not like all. Like child with a disability, particular parent, they feel like emotionally traumatized. But the child is not a burden. The problem is with the parents. Because of lack of awareness how to nurture the child, that is a very important lacking information among the parents. So intellectuals solve the problems, genius will prevent the problems. So yeah, there are two types of medical practitioner. One is the preventive medicine, second is the curative medicine. So my goal and my objective is to prevent the developmental disabilities in the society. So to create this awareness, to create this kind of awareness programs, at least we can minimize the disabilities, and also we can decrease the number of or enrollment of the disabilities in the society. So we have to work on the preventive medicine rather than curative medicine. Okay. So a happy family is a healthy biological unit in the society. If you look at a family, family is a basic primary unit of the society. So we want a healthy, happy, prosperous, joyful family. So when there is a righteousness in the heart, there is a beauty in the character. When there is a beauty in the character, there is a harmony in the home environment. When there is a harmony in the home environment, there is a order in the society. When there is order in the society, there is a peace in the nation and the world. But nowadays, what is happening? The married couple, they are not happy with each other. The family dynamics are not happy. And also, there is no harmony. So what happens? So the total irregulation, total, a kind of conflictual situation which is happening in the family. So when the family is conflicted or disorganized, finally the whole nation and the world will be disorganized. If you look at the operational definition of the World Health Organization, health is physical, intellectual, psychological, emotional, spiritual wellness. But most of us, we focus only on the physiological or somatic health, not intellectual, not psychological, not emotional, not spiritual. Because there are all so many quotients are there, like intellectual quotient and also emotional quotient, spiritual quotient, and also, the developmental quotient. So, the story of the baby when it begins. So, if you look at the story of a baby, it begins generally after the birth, they say. And some people, they say after the conception of when the woman conceives, the story of the baby begins. But actually, the story of the baby begins before birth. Before birth means when exactly? When the adolescent girl attains the puberty, the story of the baby begins. This is what everyone should understand. So children respect those who respect them. Being young does not make your emotions less valid. Children have feelings that deserve respect. They are learning how to interact, how to reciprocate with others through their relationship with us. So are we really reciprocating with our children from the day one of conception during the pregnancy period itself? This is a question mark. Every parent's dream is, their child should be the best in the health, and also the child should have a social street smartness, and the child should have proper IQ. I mean, intellectual quotient, social quotient, spiritual quotient, emotional quotient, developmental quotient, and the child should behave properly, and also child should be good at the sports, and the child should earn more financial quotient, that is. So overall, this is called super child. But to have a super child, the mother and father also should be a super mother and super father. Are the mothers are really super mothers? Are the fathers are really super fathers? Are they, having a proper awareness how to nurture the baby before the marriage? So all these matters here. So if you look at the first 1,000 days, exactly the nature designed or programmed 1,000 days, that is a numerical. 270 days the pregnancy period, first year 365 days, and second birthday again 365 days. So it is totally coming exactly 1,000 days of journey. So everything, every step, every domain has been programmed properly from the day one of conception till the second birthday of the child. So the conception to the second birthday of the child, which we need to consider. So during this period, what happens? The baby, the fetus will be exposed to so many, a variety of positive and negative experiences from the environment within the womb or from the external area. I mean, from the home environment. So it may be emotional distress, it may be a traumatic, or it may be because of the poverty, or it may be because of the violence. All these will definitely have a long-term adverse or negative impact on the developing brain of the child. So here the good nutrition to the mother and the baby and the safety and secured environment and a loving home environment is very important, and also it's a prerequisite for the healthy baby growth and development. So brain is the only organ not fully developed at the time of birth. So here 90% of the crucial brain development happens during the first 1000 days. So the story of the baby, the story of the brain starts in the womb, but the wiring takes place after. So the first 2 years of life is very crucial for the wiring of the brain. So a child born with so and so developmental disability, he or she will be having time for early intervention. But most of the parents, what they do, they will be after the diagnosis, they will do shopping. I mean, parents they'll go for the doctors have differential opinions, first opinion, second opinion, third opinion, and they will visit the different therapy centers. They do doctor shopping and all. So instead of that, they can just focus on the early intervention as soon as they identify that the child is having some problem or developmental issue. So that is very important, because till the 3rd year of the age we can do many things to the child. When it comes to the planning of the pregnancy, it should be by choice, not by chance. But nowadays, what is happening? By chance, it is happening. So being relaxed can double the chances of becoming healthy pregnant. So the woman should be relaxed psychologically, emotionally to become a healthy pregnant. Because once the healthy pregnancy happens, naturally the baby also will be healthy. But nowadays, the most of the mothers, they are going for IVF centers. I mean, the in vitro fertilizations or OSD, that is ovulation stimulation drugs for infertility, if not conceived quickly. But there are some drugs like clomiphene citrate and also follicular stimulating hormone, luteinizing hormone, and gonadotropins, metformin, latrozole, bromocriptine. All these will cause, there's a chance of 8%, maximum 8% for the twins and preterm babies. So there is a possibility of risk or the disabilities among the preterm babies too. Fertility treatments and the risk of preterm birth among the women with subfertility, a linked data, if you look at the retrospective cohort study, it is causing the preterm birth, okay, and also low birth rates. And the survey results of the Harvard School of Public Health in 2013 revealed that the pregnant women, that is during the first trimester or second trimester, who have been exposed to the severe air pollution, among which particulate matters that are 2.5 m micrometer and less diameter, that is PM 2.5 pollution, was the most serious and could cause the possibility of children in developing autism spectrum disorder, maximum by 50% of the probability. But nowadays in urban settings, there is a lot of pollution, air pollution, water pollution and all. The pregnant women definitely certainly exposing to all these PM 2.5. That is the reason, one of the etiological factor, that the autism spectrum disorder and other neurodevelopmental disabilities, the incidence and prevalence is increasing. Even the assisted reproductive technology increase the risk for autism spectrum disorder. So this assistive reproductive technology definitely leads to the factors that are known to put children at the risk of autism, such as being born a twin or multiple triplets or quadruplets, being born too early or being born too small. Okay, so if you look at the issues like premature ejaculation, ED problems, and polycystic ovarian disease, polycystic ovarian syndrome definitely can lead to infertility. So these cases that people resort finally to fertility treatments like IVF and surrogacy. So a recent study has claimed that the fertility treatments may increase the risk of autism in the children. So this is what the autistic surrogates. So the decades of rigorous research shows that the children's earliest experiences play a critical role in the brain development. Preferably at the birth, if you look at, 100 billion neurons will be formed. only 15% neuronal connections will be made. Still 85% yet to connect. So by the age of 3 years of age, 10,000 connections will be formed for each neuron. 1,000 trillion connections will be made. 2 million miles in length, it's formed. So this is the age from 0 to 3 years is a golden and critical and crucial development of the age of a child's life. 90% of a child's brain development happens prior to the 5 years of age. So this is the very good news for all the parents who have children with developmental delays, developmental stagnation, developmental regression can go for early intervention as soon as possible before the age of max 5 years of age. So the first 1,000 days, it's a singular window of golden opportunity for any child. So that's because the synaptogenesis, that is the formation of early, neuronal, sensory, motor, visual, tactile pathways. So during the early synaptogenesis, if the child exposed to any kind of gadgets, electronic gadgets, it may be a television, it may be a screen, or it may be a phone, anything, it will obstruct or it will cause the regression in the child. So this is the very, very important and crucial for the child's development. Early synaptogenesis, more frequent communication. Am I audible? Hello?
Yes, sir.
Yeah, please. So the early circuits that fire more often kept, whereas those are not used or removed. So we have to intervene the child as much as possible. We have to intervene. So what type of intervention is required during the early development? It may be like early intervention like visual stimulation, or it may be a motor stimulation, or neuromuscular facilitation, or neuromuscular coordination, or anything. So this is the, the early stimulation or early intervention is required so that the circuit will be more often kept. Pruning allows the brain to adapt to its, environment. Neuroplasticity. Neuroplasticity is the brain's potential to create or change the network of neurons based on the early experiences. So we have to give a chance to the baby to explore, to the environment. It may be when the baby is in the mother's womb or after delivery. So if you look at the Garbha Samskara, the primitive and primary social, spiritual, psychological, emotional, academic institution for any child is Adi Garbha. Adi Garbha means primitive womb, that is a mother's womb. Because the mother's womb will be considered as everything for the baby's brain, development as well as the growth. What you eat, what you do, what you experience or sense during the first 1,000 days has lifelong consequences for your health. So if you look at the Garbha Samskara, even 7,000 years old Garbha Upanishads clearly revealing that the molding of the mind and personality of the unborn, this is what the education in the womb which is happening. So when you come to the pregnancy, whether it is internal or external, I can say the both. Pregnancy is both internal as well as external. Because pregnancy continues externally for the first 2 years after birth. Even after spending 9 full months in the womb, the human babies are some of the most helpless creatures in the nature. A child needs their parents near them for a long time after they have left the womb. Baby continues to be in a kind of external pregnancy for an entire 2 years after they born. Even though baby has left the womb, they are still physically, that is through breastfeeding, emotionally, cognitively connected with the mother. So that is the reason I say the previous connection between the mother and the child is through umbilical cord and the later through the breastfeeding. It is a kind of neuro exercise, neuronutrients, because the child will receive the macronutrients from the mother through the mother's milk. It is a kind of neuro exercise because the whole brain will be under exercise so that the child who had, the breastfeeding, the child will be developing speech language communication, cognitive development and sensory development, adaptive development, social development, emotional development very properly at age appropriateness. So we have to appreciate the breastfeeding, I mean the mother's feeding. That's very important because the mother's milk itself is a complete package of all the nutrients, and also it is a kind of neuro exercise because there is a oromotor exercise which happens during the breastfeeding. So during the prenatal, the baby always already the babies learn the sense of touch during the 8 weeks of pregnancy. And also the pain sensation the baby learns through in 27 weeks of pregnancy. The taste the child will attain by the 12 weeks of pregnancy. The swallowing by 13 weeks. Hearing, listening, learning will take place during the 18 weeks of the pregnancy. The baby can recognize the mother's as well as the father's voice by the during the pregnancy period itself. So everything the baby listens from the inside of the mother's womb. So it is, if you look at the Indian mythology, the Bhakta Prahalada and Abhimanyu stories already you might be knowing. So it is clearly revealed that the baby is active, alert during the pregnancy period. So the early synaptogenesis, if you look at the sensory pathways like vision, hearing, and also language and higher cognitive function, all these synapses will form during the pregnancy period itself, not after the delivery. So it is very important for the human brain development. We have to take care of the mother as well as the child during the pregnancy period itself. So till the birth, from the conception, all these synapses formation will take place. So while DNA gives the body a plan or a blueprint for building the brain, the environment can influence its ultimate development. So what is environment? The environment is the place where the baby is undergoing the nurture. It may be the in vitro, or it may be the external, that is a home environment, or it may be a neighborhood environment. So the heredity versus nurture always. So the nurture plays a vital role. So the development of the brain is definitely influenced by the nutrients, and also severe malnutrition definitely can hamper the brain growth, cerebral cortex, and also number of neurons and connections also. And when it comes to the sleep, adequate sleep is extremely important for the brain growth and development. But nowadays, what is happening? Most of the pregnant women, they are working, preferably in the IT sectors like software and other fields, night shifts, day shifts. So when they are doing night shifts, the baby will be awake. Sometimes when the baby is having hungry, the mother will not take food. And when the mother is not having, so there won't be any kind of synchronization between the mother and child. So which is affecting directly the baby as well as mother too. So the infants definitely need 16 hours maximum sleep, and the toddlers up to 14 hours sleep. Preschoolers up to maximum 13 hours adequate sleep. Sound sleep is very essential for the overall development of the child. Some substances definitely used during the pregnancy: alcohol, cigarettes, street drugs, and some prescription drugs, and also heavy metals like heavy metal poison like mercury, lead, and magnesium, and all these will cause the adverse events on the brain and the growth of the child's overall development. Because there is even fetal alcoholic syndrome you might have heard. So the exposure to toxic substances during the pregnancy period will definitely hamper the overall child's growth and development. So the 5 R's of healthy brain development, if you look at the relationship, that is a kind of reciprocation between the child and mother and child with the family members, and also responsive, that is a principal responsive caregiving interaction, that is a positive parenting is very important. And also we need to respect the baby, we need to respect the mother too. And also yes, there should be a structured routine for the baby as well as the mother regarding the diet, and also the emotional reciprocation, and also the repetition of all these above again and again. All these will cause a good healthy brain development. Genes definitely listens to the environment. They interplay between the genes and environment, because nowadays the nurture or the environment is it became vital. Because if you look at a practical example, you pick up a child of 1 year of baby from the slum area and hand over to a white collar educated family members in the posh family. At the same way, the 1 year baby of an educated family you pick up and drop at the slum area. You see after 20 years what happens. So here the main role is the environment. That is what the epigenetics. So genetics is different, that is in the form of genes and chromosomes. Epigenetics is the environment. Nutrigenetics is the diet which has been consumed during the pregnancy period by the mother. So all these play a very important crucial role and interact with the fetus during the third trimester itself, because definitely the baby listens to you, That is very important in a private environment. And avoid carrying a mobile phone on the body or placing them on near abdomen, because it definitely causes distress to the babies, I mean the fetal movements. And also a kind of radiation also will impact the baby's brain growth and development. So always talk to speaker or setting mode only. And effects of maternal distress. So definitely during the pregnancy period, if the mother undergoes any kind of psychological emotional distress, definitely it causes preterm deliveries maximum up to 60%, low birth weight, sometimes very low birth weight, extreme low birth weight, and also developmental delays, developmental regression, and developmental stagnation in the babies. And so healthy mom, healthy dad, and healthy baby. During the pregnancy, your definitely eating habits affects your baby's overall development. Your baby depends on the good nutrition for growth and development. Making healthy food choices and having a balanced diet during the pregnancy will help prepare your baby for lifelong immunity or lifelong health. Okay, so if you look at the proteins, it definitely helps the baby's tissue develop and also repairs the breast and uterine tissue, muscles, and blood during the pregnancy period. So mother is advised to take the proteins, sufficient protein, and iron. Definitely it makes the hemoglobin, a protein that brings oxygen to tissues. The amount of blood in body increases during the pregnancy. So iron is needed to make baby's blood supply. In India, most of the pregnant women, they won't take iron folic acid tablets. That has to be actually encouraged by the family members to take regularly. And iron deficiency affects even the school performance also. Iron deficient without anemia 71%, iron deficient with anemia 72%, normal iron levels 49%. This is what the percentage of children with below average mathematics score. So folic acid, if you look at, it is definitely needed for a baby's brain and spine. It helps make blood during the pregnancy, and it also prevents the neural tube defects like meningocele, meningomylospele, and spina bifida occulta, spina bifida cystica, and all. 70% of all neural tube defects can be avoided with enough folic acid. And DHA, omega-3 fatty acids, definitely needed for brain development and growth. It also helps to stay pregnant long enough. And vitamin C, it is needed for the wound healing, helps develop baby's teeth and bones during the pregnancy period. The mother is advised to take all these. Fat content, it gives energy and helps make baby's organs and also placenta. Polyunsaturated fatty acids help with baby's brain and nervous system and retinal development. Calcium, it helps to develop baby's bones, teeth, muscles, and heart and nerve function. It is also needed for fluid control. And iodine, it helps to develop the brain and nervous system, that is CNS. And enough iodine will help babies to move, to think, to feel or sense. And even a pregnant woman on balanced diet, she may still miss out on essential micro and macronutrients. So a prenatal vitamin ideally started 3 months before she gets pregnancy. This is a very important to all the women who has to disseminate among the young women who is undergoing who is about to have the pregnancy or planning pregnancy. 3 months before only the prenatal vitamins should be started or initiated. It is recommended to make sure to all the nutrients needed for a healthy pregnancy. And recommend that women can take prenatal vitamins while breastfeeding too. This is also very important. Most of the lactating mothers, they won't take, they will neglect, they will ignore. But we need to advise, we need to recommend that the prenatal vitamins while breastfeeding too. Alcohol during pregnancy is never safe. Drinking any type of alcohol during the pregnancy definitely causes fetal alcohol syndrome. And also during the pregnancy, if the maternal mother consumes alcohol, it may cause low birth weight, very low birth weight, extreme low birth weight, and infant's oromotor will be affected. That finally causes speech language reciprocal communication difficulty, functional communication difficulty, and sleep issues like insomnia, hypersomnia, and attention deficit and hyperactivity disorder, and attention deficit disorder, specific learning disabilities like dyslexia, dysgraphia, dyscalculia, dyspraxia, and all. So pica, that is nothing but a substance abuse. If craving on substance such as ice, clay, wax, laundry detergent, dirt, toothpaste, soap, coffee grounds, and baby powder, chalk pieces, cotton balls, all these, it can be a sign of iron or calcium deficiency and should be addressed promptly by the parents. So the aim of an additional 300 calories per day for each fetus is recommended. Pregnant women with twins require almost maximum 2,800 calories per day. And prenatal exposure to paracetamol associated with the increased risk of autism and ADHD, attention deficit hyperactivity disorder. So there was a study conducted during the 2021 year. Children who were prenatally exposed to paracetamol were 19% and 21% more likely to subsequently develop symptoms of autism, even ADHD. So paracetamol, that is acetaminophen, and the developing brain, there was a study conducted again 2010 published. So this is not nowadays it's a controversial issue which is happening globally. Whether really the paracetamol is causing ADHD or autism, still the further research is required and needed in this area. So when it comes to the iodine during the pregnancy definitely boosts the baby's brain development. Severe iodine deficiency definitely it reduces a child's IQ levels maximum up to 15 points. Iodized salt definitely helps nurture a child's mental development. So iodine is mandatory here. Sometimes some children will behave in a different way. They will be having behavioral challenges like irritability nature, aggressive nature, hyperactivity nature, inattention problem, and insomnia, sleeping sickness, and all developmental delays. Why? The reason is the cholesterol deficiency and zinc deficiency, magnesium deficiency, iron deficiency, and also hypothyroidism. All these will cause these behavioral challenges in the children. Even the gut tissue also definitely will show impact on the child's behavioral issues. Epilepsy, that is seizures, conversions, sleep disorders, anxiety, generalized childhood anxiety disorder, childhood depressive disorder, childhood hyperactivity behavior, all these will be because of the gastroesophageal reflux sometimes, and diarrhea, and functional constipation, and abdominal pain, and even the stomatitis, gastritis, and all. So we need to address all these. Why? So once we get the check done, then only we will be realizing the deficiencies in the children. Okay, so there is a connection between the food and the behavior. So food, after the digestion, it goes to the gut. From the gut, again partial digestion, it goes to the blood. From the blood, again it goes to the brain. From the brain behaves. So the food which you are giving to the child, the food which you are giving to the maternal mother definitely show impact on the baby's brain growth, development in behavioral aspect too. So there is a closed connection between the food and the behavior. Sometimes some children with autism, they will choose the texture of the food. Some children choose the occurrence. Some children takes the food on the basis of taste. Some children likes the smell. Some children likes the temperature. So there is also a reluctance to try new food products in 69% respond. So this is what the study shows. Pregnant women with gums and teeth, that is periodontal disease, are at higher risk of delivering a preterm or low birth weight. So inflammation in the gums can actually get into the bloodstream and target the fetus directly, and potentially leading to the premature labor and low birth weight babies. So we have to advise the pregnant women to brush and clean their gums minimum for twice, morning and before going to sleep. So the womb is a stimulating environment. So we need to establish a rich connection between the mother and the prenate. The babies in the mother's womb are very alert, very awake, and very attentive to voice, touch, taste, and smell. So through the key ingredients of epigenetics, that is environmental, infant nutrition, that is in the form of micro and macronutrients, that is IQ nutrients we have to provide, infant programming, that is nothing but the neuro exercises through the breastfeeding, and also a nurturing epigenetics, that is nurturing environment. All these are very essential. And we have to reduce the stress during the labor, that is very important, which allows the natural birthing hormone to ensure a smooth delivery. Birthing hormones are also responsible in mother and child bond, which prevents the behavioral problems and help the children to learn more when they go to school. So labor and birth are beautifully designed by the nature. So natural birth practices are not only safe, but also good for children. So let us respect both nature and nurture in its own ways. So which is the first vaccine for child? The first vaccine is not the polio vaccine. The first vaccine is the colostrum. So the first yellow milk is vital for baby's nutrition and protection against the infection. The amount of colostrum and milk within the first couple of days may be very less, but do not worry, this quantity is very sufficient for child. It will definitely increase as the baby grows. So colostrum definitely contains so many nutrients. So we have to encourage to give the first milk, yellow milk to the babies. So infant nutrition, exclusive breastfeeding is very important. Once the baby born, immediately we have to start the exclusive breastfeeding for the nutritional needs and also brain development and emotional development of the baby. Complementary food that you can initiate after the 7th month onwards. That too, the nutrition rich foods to be given in an encouraging and playful methods, not by showing the TVs, not by showing the YouTube reels, not by showing the Instagrams, okay, videos. Micronutrients deficiency to be avoided, and munching and self-feeding to be encouraged. That is very important. And head circumference accurately reflects the brain size and growth during the first years of the life. So the average newborn head circumference measures about maximum 34 centimeters, birth to 3 months. So an increase definitely can see 1.5 to 2 centimeters per month. 3 to 6 months, an increase of 1 centimeter per month. And 6 to 12 months, again, total maximum 11 centimeters gain. And the next 12 months, 2.3 centimeters gain per year. This, the pediatrician, general pediatrician has to observe the head circumference whenever the baby visits the well baby clinics. So the baby is having so many emotions during the drowsy or during the active sleep, during the deep sleep, during the quiet alertness, during the active alertness state, and during the crying. So many emotional apprehensions, facial expressions, eye contact, gestures, postures you can see in the babies or on the baby's eyes and the overall, the posture. So when it comes to the delivery, spouse or family member to accompany during the childbirth, it is very important. The moment a child is born, the mother is also born. So whenever we are celebrating the children's birthday in the family, we have to celebrate the mother's birthday too. So then only we will honor both mother and child. So if you want your children to be intelligent, read them fairy tales. If you want them to be more intelligent, read them more fairy tales, as Albert Einstein said. So children are children, and based on early experiences through multisensory integration, children will learn. This is what the Dr. Chukani had shown the activity of the brain at various ages. So the processing will take place during the early childhood development. It may be the auditory processing, it may be the visual processing, it may be a tactile processing, or it may be gustatory or olfactory. Whatever, it is a multisensory integration which happens in a natural way, because the firing will take place. The neurotransmitter hormones like dopamine, serotonin, acetylcholine, GABA, all these hormones will fire and secrete at normally appropriate levels. But in a child with attention deficit and hyperactivity ADHD, the severe moderate ADHD child, it happens in a different way. So we have to address all these problems from time to time. Many things we need can wait, but the child cannot. Now it is the time his bones are formed, his mind is developed. So to him, we cannot say tomorrow, his name is today. So please do not postpone when you identify a child with risk, or when you identify a child with any disability, when you identify any child with a difficulty or a disorder or whatever there may be difficulty. So these are very important. We need to address immediately. Even the National Early Childhood Care Education Policy very clearly stating under National Education Policy NEP guidelines that from birth to 3 years, the child is having rights for survival and in a safety environment, in a protective environment, and also he is having rights to get the health care, that to primary health care, and also proper balanced healthy nutrition, including infant and young child feeding practices. And also the child is supposed to attach to an adult, preferably the mother and father. Opportunities for psychosocial stimulation, early interaction, it should be safe, nurturing type, and also positive stimulating environment within the home of the child. That is very important. It's clearly the ECC, that is Early Childhood Care Education Policy, is revealing. So early childhood development, ECD, for every child, early movements matter. So early movements when? Not after the birth, from the day one of conception only, the early movements can be considered. So, as James Heckman, who is a Nobel laureate in economics, he clearly stated, he suggested to all the development and developed and developing countries, why to waste the money on the human resource development? Why to waste the money on the disability welfare department? Why to waste all these curative modalities and treatment and rehabilitation? It is very simple. If you start investing on the prenatal programs, there won't be any kind of disability in the society. There won't be any kind of the disorders in the society. So we can save much, and also we can protect the children. So early childhood development is a very smart investment. The earlier the investment, the greater the returns we can get from the society, which is constructive. Even the Lancet in 2016 published the Advancing Early Childhood Development from Science to Scale. The series focused, the series emphasized, and the series prioritized on the nurturing care, especially of the children below 3 years of age from the day one, that is from the conception till the 3rd year of age, they mentioned. So if everyone generally takes the inoculation or the vaccination, but for the baby, what is the inoculation? It is very simple. What the baby needs is, a meal and a lullabies and a hug and a kiss and a play and love and smiles. So this is what the long-term emotional inoculation, which is very essential for the baby. So for that, the parents are advised to spend quality of time with the children, with their children. So there should be an emotional bond, reciprocation. Then only it will be helpful to the baby for the future development. The toxic stress in the child definitely derails the healthy child's development, and it can have long-term negative impact on the learning, behavior, physical, and mental health of the child. So we should not give toxic stress during the pregnancy to the mother and the child, and even after birth, we should not give to the mother and the child. So we have to give the eustress, that is a positive stress, not the distress, not the toxic stress. If you look at the persistent stress, definitely change the brain anatomy, brain architecture. The normal neuron will be having many neuronal connections, and the child who is undergoing toxic stress, the fewer connections will be lost. So there will be a damaged neuron. So the growth of the baby brains literally requires positive interaction between the mother and infant. The development of cerebral circuits depends on it from the beginning of the 3rd trimester itself to the 24th month of the life. The human brain more than doubles in size, but only if it gets the right positive experiences. So this is what the early circuits. So we have to form the circuits which are positive, not the negative. So it is that during the first 2 years of life, that is nothing but the first 1,000 days of life, that the baby's immune system matures and ripens considerably. Staying close to mom and being breastfed during this duration ensures the healthiest development, like developmental quotient, emotional quotient, social quotient, spiritual quotient, intellectual quotient. All these will be formed. So for a baby's development, do not rely on the genetic code only. This is very important, as a significant role is played by the epigenetics, that is the environment which you are providing, which we are creating. So we have to create in a positive way to the child. The behaviors that are the result of the screen time, there are so many. Most of the mothers nowadays, they are exposing themselves to the electronic gadgets, and they are exposing the babies, young babies, to the gadgets. So it will cause the psychosocial consequences: autism spectrum disorder, poor memory, poor motivation, depression, anxiety disorder, poor attention span, attention deficit disorder, poor cognitive function, poor judgment, obsessive compulsive disorder, psychosomatization disorder, dissociation disorder, introversion personality, psychotic behaviors, poor anger management, and explosive temper tantrums. So all these are all because of the excessive exposure to the screen at earliest. So please do not use TVs, video games, smartphones, and computers for engaging small children's brains, not even assisting during the feeding time. This is very important, especially for the first 3 years. It is a sincere advice to all the parents. Effect of the screen exposure on the brain, if you look at the MRI or PET scans, it's clearly visible, a lot of impact on the cerebral hemispheres in many areas got affected. So too much gadget use can damage your child. It can cause the speech language communication developmental delay, attention deficits, learning problems, sleep issues, childhood anxiety, childhood depressive disorder. Our survival as human community may depend as much upon our nurture of love in infancy and childhood as upon the protection of our society from external threats. So angels in the nursery. So the intergenerational transmission of the benevolent parental influences, that is a positive. This is what the positive. So we have to have a proper emotional, social reciprocation with our children, not like the ghost in the nursery. Nursery is the home environment. It is a psychoanalytic approach to the problems of impaired infant-mother relationships. So the mother is under distress, the child also will be under distress. So this is what we do not want, the ghost in the nursery. So this is the depression case. This is not the breastfeeding. The mother is not in the mood. She is not in the positive mood, but she is giving the milk to the baby. So what happens in the mother's body? The negative hormones will be secreted because of her distress. So the negative hormones will be transmitted to the babies through the milk. So the mother should be happy when she is giving the mother's milk. Then only the positive hormones in the mother's body will be transferred to the baby's body. So you can see the ghost in the nursery. Okay. Out of 5 children, 1 child have a parent with mental illness nowadays. It's a clear research. Necessity to provide relevant support. This is very important. So mood disorder we can present in a spectrum during the maternal's time. So maximum 20% of the postpartum women nowadays are experiencing anxiety and depressive disorder. So these disorders have unique neural profiles during the postpartum period compared with generalized anxiety disorder, mood disorder at the time over times. Postpartum anxiety, depression, and the neural mechanisms overlap and interact with the system of maternal caregiving behaviors too. So mother and infant interactions finally are susceptible to disruption in the home. So nowadays what the child is feeling? Child is feeling like forgotten, removed, alone, lost, abandoned, forsaken, neglected, rejected, deserted, lonely, unwanted, ignored, isolated, excluded, unlovable, so many. This is what the present global child is having. All these clinical manifestations are the traits or symptoms. So we don't want these. We want opposite to these. So 80% of the new parents felt both anxious and completely unprepared nowadays with the practical skills they need to look after of their new baby. So we have to educate the young women of the country, then only we can have healthy pregnancies. The decision to have a baby should be made mutually between the husband and wife. It's not the husband side, it's not the wife side alone. Both should be mutually agreed. The most valuable thing is love. The most valuable gift that a child can receive is free of cost. It is not available in the dispensaries or the pharmacies. It is simply a parent's love, parent's time, parent's support. Science is now showing why baby's brain need love more than anything else. The new science of epigenetics is discovering more and more how our genes, how our brains are affected by the lives we lead. Are we really leading a healthy, happy life? It's a question mark. First of all, we have to take care of ourselves, then only we can take care of our children. The actual counseling is required for the parents, not for the children. Vital, practical, loving parenting skills are the building blocks of baby's care and well-being. You cannot blame any educational institution because you have not nurtured values in your child during the first 1,000 days. As I told you, the first institution for the baby is the mother's womb. The second school for the baby is the mother's lap. And the third institution is the home environment where the child creeps and crawls and stands, walks and all. And the fourth institution is the neighborhood environment where the child will explore during the play with the peers. And the fifth institution is the school or nursery or play school. So this during the transition from the first 1,000 days, during the 1,000 days, we need to nurture the values, morals, ethics, everything. So we cannot blame. And nowadays everyone is after the Google, Dr. Google. So many people are developing idiot syndrome nowadays. That is internet derived information obstructing the medical treatment and worrying about its side effects. So they are developing cyberchondria. Please do not rely on Dr. Google. Meet or consult the clinician. for the clarification or verification. So monkey see, monkey do, monkey feel. Whatever, however we are, same our children too. So we have to shape ourselves, our parenting style, then only our children will be proper. So at Oxford University, Dr. S. Radhakrishnan said to the students, there is a question asked, what is the difference between a station master and a school master? So he replied that a station master minds the train, the school master trains the mind. So very excellent contrastable statement and answer he replied to the students when they asked this question. It's really a wonderful and meaningful and insightful answer. So we need to work out on the preventive medicine rather than curative medicine. As Christian Barnard, who is the first heart transplant surgeon in the world, he said, I have saved the lives of 150 people by heart transplants. If I had focused on the preventive medicine earlier, I might have saved 150 million. So we have to educate, we have to disseminate this knowledge among the young women and young men of the country. Then only we can prevent the developmental disabilities. Because early intervention itself is an introduction of planned programming, deliberately timed and arranged in order to alter the anticipated or projected course of development. So in pediatrics, early means the critical periods, that is 0 to 3 years. So the experience, the exploration and the play with the things around by the child itself is an early intervention in a positive way. So we need to catch them young and we need to intervene very early. So this is what the early identification and early screening and also prevention of developmental disability. We need to bridge the gap between the myths and the science, evidence-based practice. Any doubts? Thank you so much.
Thank you, sir, for your very elaborate and detailed presentation. You have covered a lot of topics in detail. We request all the participants to, share your queries and feedback. You can raise your hand or you can unmute yourself.
Thank you so much, sir, for giving a very wonderful seminar. We are gaining a lot of knowledge, which you have gained the knowledge and you are sharing us to the future, Actually, I'm planning for conception and you have gave me a lot of, not only you, the previous speakers also, I gained a more knowledge, which I already learned, but through your words, it has been like, as you said, now myths. So we need to avoid the myths and we need to get into the actual reasons or evidences. So I'm getting a lot of knowledge, sir, through this seminar. And thank you so much for all of you for conducting this sort of seminars.
This just want to present one video here. If you permit, Dr. Ravi, can I?
Yes, sir. Please go ahead.
Any sound is coming?
Yes, sir. Thank you.
Here, this is the NICU environment, newborn intensive care unit. So generally the babies with preterm, low birth weight, very low birth weight, extreme low birth weight, neonatal sepsis, neonatal jaundice, neonatal infections will be admitted. So you can see the babies in the cubicle are under the blue light. And also the baby body, if you look at, having the IV lines, which is the painful somatic stress to the baby. I mean the body stress. A newborn baby is undergoing physical or somatic stress. First point. Second is the sound. You can hear the sound. It's a high intensified sounds of the monitors. So the sound also will affect the auditory processing pathways, and visual pathway will be affected through because of the blue light. And also the baby is left alone without the mother. So mother is not there for the treatment purpose. Mother is at somewhere and the baby at somewhere. So there is no emotional physical bond between the mother and child. So because they got separated, this baby may develop separation anxiety disorder, SAD. And also so many. So these are the babies, they are going to suffer in the future like what? Like they may suffer with autism spectrum disorder, cerebral palsy, attention deficit disorder, attention deficit hyperactivity disorder, and some other learning disabilities like reading disorder, dyslexia, writing disorder, dyscalculia. I mean, sorry, writing, that is dyslexia, dyspraxia, dyscalculia. There are 3 poles, even dyslexia also. So why this? Because of the early synaptogenesis is affecting. Early neuronal, sensory, motor, visual, tactile, auditory pathways are altered or derailed or disturbed. That is why the child is getting so many disorders or disabilities. So what I want to tell you here, we are advising the NICU nursing care staff to minimize the sounds of the monitors and also the intensity of the blue light. Okay. And also some kind of frequent visits between the mother and the child to the NICU. So we can minimize the disability. And because most of the neonatologists and pediatricians, they focus only on, generally to give the life support to the baby and get discharged with NICU graduation. But so many developmental disabilities the child will get after admission in the NICU. So what I want to tell you here is conclusion is the child, whoever may be in NICU, should be under neurodevelopmental follow-up program up to minimum 4 years of age, minimum 5 years of age. That for that reason, neonatologist or the pediatrician should call the baby again and again frequently at regular follow-ups for evaluation, for periodical evaluation about the the development and the growth in all the developmental milestones. So NICU is very important here. Okay. Yeah. Yes, please. Any doubts?
Yeah, participants, feel free to unmute yourself or use chat box.
Yes, Doctor, thank you so much for your presentation. This is not only about the 1,000 days. You also mentioned about how the mother has to be along with the child so that they don't get any neurodevelopmental disorders up to 3 years.
Hello, ma'am.
Yes.
Yes, ma'am. Please continue.
Okay. So as a remedial educator who has been dealing with all the children for almost 3 decades, sir, I've seen this. So I can just imagine when you play the ICU with the monitors alarming there, how would it be? Like later only I came to know even the parents are not allowed inside. So I'm just imagining how these children will become later on. Thank you so much for throwing some light, and parents will come to know about this. Thank you very much, Doctor. Thank you, sir.
Thank you.
Dr. Ravi, this session, I think this assembly needs one more video to be shared. The audience.
Yes,
one last video, okay? Okay. About the parenting.
This is the greatest lesson for parents. No one really truly loves anyone. Everyone loves conditionally. Most love is conditioned, control-based, and fear-based. It's all about the self. So we live off prescriptive checklists and believe that if we don't follow that checklist, then we are somehow lesser than. And when we do this with a child who's come into this world with a throbbing spirit, desirous of kind of figuring it out, and we've kind of already ruined that chance by, here's the checklist. This is what I believe is success and failure and beauty and achievement. And now follow my way or you're already an outcast in my eyes. This immediate placement of a way to be obscures the ability for the child to develop their way. And you will see most parents do not accept their children for who it is they are, because they're not good enough or great enough or fabulous enough or not some accolade enough, not a degree enough. And then I show parents that the reason they can't do this, accept their child unequivocally for who it is they are, is because they haven't accepted themselves for who it is they are. The main battle is my child is not who I thought my child would be. Either not a superstar soccer player or a fantastic pianist or obedient, genuflecting little servant, Most parents who are raised on a diet of overachievement, on doing, have a very hard time understanding that their drive is not organic necessarily, but coming out of their inadequacy, their fear, their lack. They've just been indoctrinated to compensate for this, and they've never fully healed from their encountering their ordinariness. And so when I say that that's what's driving you, and then they get in touch with their little boy or little girl who truly felt ordinary and not good enough in that ordinariness, that's when the epiphany occurs. So then I make them see how it's now being projected onto the child. Don't do this to your child. Your child is okay and whole in their ordinariness. The child doesn't need more to feel more of themselves. They didn't come with this egoic desire to attach to PhDs or labels or judgments or wealth to feel themselves. Children feel themselves just by who it is they are. They have the simplest access to wholeness. We rob them of this. To truly love someone, it's truly loving the other for who it is they are, with no you in the picture. They don't have to love you back. They don't have to need you. They don't have to agree with you. They don't have to adhere to you. Now try loving your child for who it is they are.
Thank you.
Yeah, thank you, sir. It was nice video, both of them, all the videos and a very wonderful presentation. Participants also really enjoyed. I think there are a lot of appreciation messages in chat box and in the form of reactions.
This is very concise, short presentation. It is a version. Whenever we talk about a child, it's a subject of version. It's only dropped today, we dropped it. So,
be nice, sir. We can
thank you so much.
Offline sessions in coming days where we can have full day workshops or something like that, where we can focus on particular issues.
Doctor, this small drop has so much of content. So I think for the upcoming generations and for the parents, you should have some para sessions like for a week or something, The parents will be benefited.
Definitely, ma'am.
Thank you.
Definitely, as I'm working on towards to the prevention of the developmental disabilities in the society, it is my duty to disseminate my knowledge and skills to everyone in the schools, colleges, and all. You can contact Dr. Ravi for my contact number and all, whatever.
Sure, doctor.
You can have, no problem. Thank you so much.
Thank you very much. Thank you, doctor.
Thank you.
Yeah, thank you, ma'am. Any others who would like to share? You are welcome. Before concluding. So thank you once again.
Sir, thank you, sir. It is once again a wonderful, I can say, extraordinary presentation of knowledge for the younger generations. Really appreciated your presentation, sir. My regards to you once again.
Thank you, sir. Thank you so much.
Yeah. Thank you, sir. So if there are no further queries, I see a lot of appreciation. Yeah, Dharani, do you have any query? See, kindly keep yourselves muted when we open the mics for Q&A, unless and until you have any query. Okay. So I think that's a wonderful session. We all have learned so much today since morning. And thank you, Dr. Jagdish sir. You have been a very nice person and very humble, down to earth as a profession and as a person. And the way you presented also reflected the content and as well as the delivery that has spoon-fed all the participants with enormous information. So we once again thank on behalf of the organizing committee, and we wish you all the success and look forward for more sessions in future.
Thank you, Dr. Ravi. Thank you.
So now we will move on to our next session. Now, the next session we have with us Professor Dr. G. Sri Krishna sir, who has over 3 to 4 decades of experience as a clinical psychologist, and he has worked with various national and state level organizations like NIMH, now known as NIPID, and also SWICAR, and now presently working as a professor and head Department of Clinical Psychology, Helen Keller Institute. And he is also a supervisor for more than 7 universities as a research guide to PhD scholars, and he has guided more than 200 MPhil scholars, and he has guided more than 5,000 interns and so on. He has extensive record of organizing various programs for parents, children with disabilities, and human resources working with children with disabilities. With this short brief info, I would like to invite Professor Dr. G. Sri Krishna sir to deliver his talk on developmental disorders and overview. You can now unmute yourself, sir, and start your session.
Yes, thank you, Ravindra. I'll be sharing my presentation. I'll just give a brief overview about developmental disorders.
Yes.
Just a second. One second. Ravindra, 1 minute. I'm not able to get my.
Okay, sir.
1 second. Okay, is my screen visible, Ravindra?
Not yet, sir.
Okay, 1 second. Now?
Yes, sir. Now it's visible. Please continue.
Okay, good afternoon, everyone. And I'm very happy to see some of my students for joining this session. So I'll just give a brief. Okay, my video is not on. 1 second. How to on the video? I'm not able to see. Okay.
Now you are visible.
Okay. So developmental disorders. So the paper talks about the theme first 1,000 days breastfeeding and maternal and child mental health. So the abstract is this seminar paper presents comprehensive overview of developmental disorders and highlights the importance of the first 1,000 days of life. It integrates evidence from developmental neuroscience, psychology, pediatrics, public health, and maternal mental health to explain how breastfeeding, nutrition, nurturing care, and early intervention shape lifelong outcomes. So learning objectives understand developmental disorders, explain the significance of the first 1,000 days, describe the relationship between breastfeeding, maternal mental health, and child development, identify early warning signs and evidence-based interventions, discuss Indian public health initiatives. So as I told my inaugural address, so the development begins from birth and continues rapidly through the first 2 years of life. During this period, the brain forms millions of neural connections every second. Genetics provide the biological foundation, while nutrition, breastfeeding, responsive caregiving, secure attachment, healthcare, and environmental stimulation determine how this genetic potential are expressed. Developmental disorders emerge when developmental pathways are disrupted by biological, environmental, or psychosocial features or factors. As I told, John Bowlby has done a lot of experiments on attachment, secure attachment, insecure attachment, leading to later development of psychological disorders. Even Harlock also demonstrated with monkeys, like mothers and children, how the bonding is very, very important. So developmental disorders, all of you are quite familiar. So these developmental disorders, according to DSM-5, discuss autism spectrum disorder, ADHD, attention deficit hyperactivity disorder, intellectual disability, communication disorders, motor disorders, specific learning disorder, global developmental delay, and cerebral palsy. Explain prevalence, characteristics, diagnosis, and long-term outcomes. So when you see the brain development during the first 1,000 days, describe prenatal neurogenesis, synaptogenesis, myelination. Actually, previously, Dr. Jagdish sir already explained all those things, so I'm skipping this particular one. So they're also prone to language exposure and reduced toxic stress. So breastfeeding and neurodevelopment, exclusive breastfeeding for 6 months and continued breastfeeding with complementary feeding provides optimal nutrition, immune protection, improved cognitive outcomes, emotional bonding, microbiome development, and reduced infection risk. Discuss human milk, bioactive components, and breastfeeding counseling. And maternal mental health, all of you know that during the pregnancy and after the delivery, the mother mental health is very, very important. Otherwise, it will lead to maternal depression, anxiety, stress, trauma, domestic violence, and poor social support effect, fetal programming. Attachment, infant emotional regulation, feeding and language development, discuss antenatal screening, postpartum depression, counseling, and community-based mental health services are very, very important. So, as Ravindra said, that the child development and the child healthiness also lead to the growth on the planet. Risk factors, genetic disorders, prematurity, low birth weight, birth asphyxia, infections, environmental toxins, alcohol, tobacco exposure, malnutrition, poverty, screen overexposure, neglect, and adverse childhood experiences. Also, Dr. Jagdish talked about the screen overexposure. Nowadays, most of the mothers are feeding, during feeding, they are showing videos and other things which should be restricted. So, early identification, developmental surveillance, milestone monitoring, standardized screening tools, red flags at 6 months, 9 months, 12 months, 18 months, and 24 months, referral pathways and multidisciplinary assessment is very, very important for early identification of developmental disorder. And evidence-based intervention, we have evidence-based early intervention, speech language therapy, occupational therapy, physiotherapy, applied behavior approaches where appropriate, parent-mediated interventions, inclusive education, nutritional rehabilitation, psychological counseling, and assistive technology. So when you look at the Indian perspective, discuss ICDS, Poshan Abhiyan, Rashtriya Bal Swasthya Karyakram, National Health Mission, Ayushman Bharat, Early Childhood Care and Education under National Education Policy 2020 and Rights of Persons with Disability Act 2016 and Community-Based Rehabilitation. So the India is also actively involving in early intervention. So the recommendations for reducing the developmental disorders, strengthen antenatal care, breastfeeding support, maternal mental health screening, developmental surveillance, universal newborn follow-up, family-centered care, multidisciplinary rehabilitation, digital health, community awareness, and policy integration. So in conclusion, protecting the first 1,000 days is one of the most cost-effective public health investments. Healthy mothers, successful breastfeeding, early nurturing relationships, timely developmental screening, and coordinated intervention can substantially reduce disability and improve educational achievement, productivity, and quality of life. So this is a brief presentation about the developmental disorders and prevention and intervention. Prevention is better than cure. So we need to focus on the earliest days of child care. So these are my references. And if one wants to understand about attachment, secured attachment, and also Bowlby has studied the comparison between institutionalized raised children and parental home raised children. There is a lot of psychological problem happening in institutionalized children. So I would like to conclude that not only the mother parents have a very vital role in the developing the child body and mental health. Thank you, Ravindra. That's all from me.
Thank you, sir. In brief, you have covered the entire topic, and it was very insightful. And thank you for taking some time for your valuable presentation. Now, the forum is open for Q&A. You can raise your hand or you can unmute yourself.
I think Jawaharlal Nehru wants to talk.
Yes, sir.
I know him for more than 2 decades. Yes,
Sir,
Jawaharlal,
sir.
how are you?
My regards. Thank you, sir. It's an elaborate, excellent presentation, sir. Subject about 1,000 days, you are really giving in depth to the audience. Majority of the people are reading. Actually, Jagdish sir also has given this. You have still given much more subjects, sir. Thank you, sir.
Yeah, Jawaharlal Nehru. I just gave an overview of developmental disorders. Actually, Dr. Jagdish has lessened my effort because he has covered globally and comprehensively elaborated explanation. I think more than 169 slides. Really, hats off to you, sir.
Thank you. Thank you so much.
Thank you, Jawaharlal Nehru, for the kind encouragement.
Thank you, sir. Thank you, sir.
Yeah, thank you, sir. Any other participants? You can unmute yourself. We encourage everyone to share your feedback, queries. There are a few appreciation messages in chat box. Thank you, sir. So for your valuable time and joining us and
Thank you,
contributing
Ravindra.
to this valuable and value addition to this national conference and for your support in organizing this national conference. Now we are moving to the last session by myself. So I will be talking on breastfeeding, a way forward for securing a healthy planet and achieving sustainable development goals. So how breastfeeding is promoting the sustainable development goals and how we can achieve a healthy climate and healthy planet as well. Because for a healthy planet, we need a healthy environment and we need a healthy climate. So we'll be discussing on this. Before that, we'll take just a minute break and join back. Give me a minute to start my session. Yeah, good afternoon, everyone. Thank you for patiently listening to all the sessions since morning. So today, myself, Dr. Ravindra, will be presenting on, sustainable how breastfeeding is going to contribute for a healthy and sustainable planet. And also, we were talking about sustainable development. and the United Nations has come up with sustainable development goals, and more than all the countries have ratified to adopt and implement sustainable development goals and achieve those sustainable development goals by 2030. Now, this week we are commemorating and celebrating World Breastfeeding Week from August 1st to 7th. So breastfeeding lays a foundation for the first step towards sustainable development. Let's see how these breastfeeding practices and breastfeeding helps in sustaining development as well as making it a more sustainable, healthy planet. So today, when we are talking about sustainable development goals, then what are these sustainable development goals? Now, let's look at these 17 goals, right? As part of the UN SDGs framework. The first goal is end poverty in its all forms, everywhere, right? And the second goal, end hunger, achieve food security and improve nutrition and promote sustainable agriculture. And third goal, ensure healthy lives and promote well-being for all at all ages, right? And fourth goal, ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. And fifth goal, SDG 5, achieve gender equality and empower all women and girls. SDG 6, ensure availability and sustainable management of water and sanitation for all. SDG 7, ensure access to affordable, reliable, sustainable, and modern energy for all. And SDG 8, promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation is SDG 9. SDG 10, reduce inequality within and among countries. SDG 10, reduce inequality within and among countries. And SDG 11, make cities and human settlements inclusive, safe, resilient, and sustainable. And SDG 12, ensure sustainable consumption and production patterns. And SDG 13, take urgent action to combat climate change and its impacts. Today we are facing climate change, and we are seeing El Nino effect everywhere across the world, and especially it is very high impact in India. Now, in this situation, how we are going to sustain the food production, food consumption. So ensuring sustainable consumption and production patterns is very much essential in achieving sustainable development goals by 2030. And also, SDG 14, conserve and sustainably use the oceans, seas, marine resources for sustainable development. We need to understand that resources are limited. We don't have anything like unlimited resources. All the resources are limited. Unless and until they are utilized in a proper way, unless and until we prevent underutilization or overutilization or exploitation of resources, we cannot achieve sustainable development, neither we can achieve sustainable development goals. So that is why we need to conserve and sustainably use all the natural resources and as well as artificial resources. Now, SDG 15 talks about protecting, restoring, and promoting sustainable use of terrestrial ecosystems. Ecosystems are very crucial for the sustenance of life on this planet. And SDG 16 talks about promote peaceful and inclusive societies for sustainable development. Among the societies, there should be peace and harmony so that all the societies can survive and thrive. And SDG 17 talks about strengthening the means of implementation and revitalize the global partnership for sustainable development. We need partnerships. We need to collaborate. We need to cooperate with each other. We need to come together as a collaborative partners, like we are organizing this, to achieve these sustainable development goals at a local level, regional level, national level, global level, so that we can have partnerships in disseminating, in working together, and also having implementation partners at each level to achieve these sustainable development goals. Now, how these breastfeeding practices are going to address these and achieve sustainable development goals? Now that we are aware of what are these 17 sustainable development goals, now let's look at, we have seen from the earlier eminent speakers and resource persons today, since morning, they were talking about breastfeeding. Now that we are aware of breastfeeding, and now that we are aware of sustainable development goals, let's link both breastfeeding and also sustainable development goals, and how breastfeeding is going to address and going to support these sustainable development goals. Now, coming to what SDG 1, no poverty. Breastfeeding is natural, right? No additional investment is required. Every mother is endowed with breast milk, right? So there is no investment required. There is no additional efforts that is required. It is natural. So breastfeeding is a natural and low cost or no cost way of feeding babies and children. There is no need to buy anything, right? There is no investment required. There is no infrastructure required. Already human body itself is an infrastructure, and human body itself is a manufacturing plant. Human body itself is a distribution process and a supply process where the breast milk, the healthy nutrients, safe nutrients which are required, which are essential for the babies, are provided by the mother. So thus we can say breastfeeding is natural and no cost or a low cost way of feeding babies and children. So by this we can reduce poverty. Otherwise we need to buy milk, for like there is an essential feeding for 6 months where it is mandatory, and for next 2 years the breastfeeding can be continued for the optimum nutrition of the child. So assuming say at least 6 months, and then followed by supplementary for another 1.5 years. So for 2 years, if we are consuming, for 2 years, if we are buying milk, how much it would cost daily? How many can really afford that much? Now, taking into the BPL, below poverty line, and also even others, there is a huge investment that goes. And how safe is it? Now we are seeing a lot of adulteration issues because of there is a huge gap between demand and supply. There is more demand, but there is less supply. There is more demand, but there is less production. So adulteration takes place, and affordability, accessibility also matters. Not everyone is able to afford. So automatically what happens, people are adultering it so that it can be offered at a low price by, reducing the quality or altering the quality of food and various other services. So here, the household budgets are often a major factor that, promotes poverty, and that, that helps in managing the finances, that will help them to stay away from poverty, because breast milk is affordable for everyone and does not burden any household budgets compared to artificial feeding or, Formula 1 milk or any other alternatives or substitutes. So this way breastfeeding continues to make families sustain and contributes to poverty eradication and also poverty reduction, so that there is no investment. That is the greatest benefit from breastfeeding, which is highly nutritious, and there is no adulteration, and with the right temperature, the essential nutrients is served to the baby directly without any contamination. So now, through breastfeeding practices, we can achieve the goal SDG 1, no poverty. Now coming to SDG 2, zero hunger. Now, we see there are a lot of hunger deaths happening every day across the world. Why? Because there is not that there is adequate amount of food that is not available. Our planet is producing 6 times more than it is required on the planet. No, we are wasting a lot of food every day across the world. And many people are dying with hunger across the world every day. Now, there is a huge gap between the production and consumption. And this wastage happens at the production place, at the distribution place, at the supply place, at the retail place, and also at the consumer place. Now, affordability, accessibility for procuring this food also matters. So in this context, hunger is prevailing across the world and hunger deaths are happening across the world. Now, how do we address, right? There are many people, and especially an infant, right, needs regular and adequate food supply and essential nutrients. Again, there is a non-availability of food creates a lot of issues with respect to development, and also it will also lead to further hunger deaths. So now, with breastfeeding and exclusive breastfeeding and continued breastfeeding for 2 years and beyond provides high quality nutrients which are essential and provides adequate energy and help prevents hunger, undernutrition, and obesity. Earlier speakers were also talking about undernutrition, malnutrition, right? So this can be prevented when breastfeeding is continued till 2 years along with the food substitutes. So that provides food security for the infants and also promotes mother's health and well-being. Now coming to SDG 3, good health and well-being. Now, as we have already discussed, breastfeeding significantly improves the health, development, and survival of infants and children. It also contributes to the improved health and well-being of mothers, both in short as well as long term. So the benefits have been briefly discussed by the earlier presenters in brief and in length, so I'm not getting into detail. So SDG 4, quality education. Now, how breastfeeding is promoting quality education. Breastfeeding and adequate complementary feeding are fundamentals for readiness to learn. See, when we are ready to learn, how we become ready to learn? When we are adequately nurtured with essential nutrients, when our physical body and our mental body, our mental health, mental aspects, psychological aspects are very well prepared, and that readiness for learning happens, we will have quality learning process. And with that quality learning process, we have this quality education. And breastfeeding and good quality complementary food significantly contribute to mental, cognitive, psychological, and other domains of development and promote learning. And coming to SDG 5, gender equality. Now, there is a huge gap in gender equality where we have 50% of the population male and 50% of the population is female, more or less a fraction of, percentage. When we have half of the population as male or female, there is a gender disparity between the genders in various aspects. So breastfeeding is a great equalizer, giving every child a fair and best start in life, irrespective of gender of the child or the infant. Breastfeeding is uniquely a right of the woman, and they should be supported by the society, by the family, by the community, by the states to breastfeed optimally. So the breastfeeding experience can be satisfying and empowering for the mother, who represents women, the 50% of the population. So where gender equality is promoted, where women and mothers have the right to exercise their decisions and choose what's best for her and for her child. Now coming to SDG 6, clean water and sanitation, breastfeeding on demand provides all the water a baby needs. And even in hot weather or cold weather, it doesn't matter. Breast milk is always at right temperatures, at appropriate temperatures, that is best for the baby. So formula feeding requires access to clean water and hygiene utensils to mix, to prepare the Formula 1 mixture, and then the environmental hygiene is important and sanitation is required. And for again cleaning, you need a clean water, the environment should be clean. All these can contaminate even the Formula 1 milk before it is fed to the baby. Now, so that's how by breastfeeding a baby on demand provides all the essential requirements. There is no additional sanitation requirements, as mother takes care of her, hygiene properly. So there is no additional requirement for water, as the mother maintains her health, keeping her breast clean naturally. So there is no additional requirement of water or sanitation to be maintained. So that reduces and also meets the goal of clean water and sanitation. Now coming to SDG 7, right? Affordable and clean energy. Now, when we need to produce substitute food, we need energy, right? And we need, most of the energy that is produced is through fossil fuels. That is, we are using coal or petroleum products or other fossil fuels to manufacture energy source, and that energy is used. So that causes a lot of destruction and a lot of pollution and emission of greenhouse gases, right? And in the process of production, a lot of pollutants are released into the environment, and a lot of destruction that plays on the planet in the process. So now, by promoting breastfeeding, right? Breastfeeding entails less energy or no energy than formula production. So in formula production, you need to collect milk, you need to prepare powder from the milk, and then essential nutrients, it has to be fortified with essential nutrients, minerals, and required for the baby. And then it has to be safely packed, and it has to be distributed, and it has to be supplied to the retail stores, and that has to be procured by the mothers, and then it has to be prepared again with a clean water in a hygienic environment, in a clean utensils that is being served to baby and fed to the baby. So there is a huge process where energy is required for transportation, for production, for supply, for preparation, and all these, lot of energy is required, and that energy is produced by different sources which are unconventional, which are not sustainable, right? Where limited resources are used, and because of that, we are not really looking at the clean energy aspects, because we are still a long way to go ahead. Now we have more cleaner energies like solar power, wind power, thermal power, right? Where we are leveraging the benefits in production of food. All this can be avoided, right? With breastfeeding that entails less energy, right, than any substitute production or formula production. Now, it also reduces the need for water or firewood or fossil fuels in the production process. So in this way, it also supports the affordable and clean energy. Now, SDG 8 talks about decent work and economic growth. So breastfeeding women who are supported by employers are more productive. You can see when mothers are supported, in their, prenatal, postnatal period. Women feel more secure, women feel more supported, and women also are more productive and loyal because employers care for their health, care for their children. So maternity protection and workplace policies enable women to combine breastfeeding with employment. They can continue their employment with frequent breaks for the mother to feed their babies in a hygienic environment that provides more opportunities, which otherwise would prevent women to attend their work at workplace. So this provides decent work as well as economic growth because they are still in employment. Otherwise, they could have been out of employment. So these initiatives help in achieving decent work and economic growth through breastfeeding practices, which are being continued even at workplace. So SDG 9 talks about industry innovation and infrastructure. With industrialization and urbanization, breastfeeding mothers need workplace support, as we have discussed earlier. We need policies that support breastfeeding. We need breaks and time reduction or time extension where mothers can exercise their breastfeeding rights, including crutches, lactation rooms, breastfeeding breaks, and so on. And that's how, through breastfeeding, we can promote and we can achieve this goal of industry innovation and infrastructure by providing necessary infrastructure for the women for breastfeeding practices and for practicing, breastfeeding and nurturing child health and care. And coming to SDG 10, reduced inequalities. Now, we have a lot of inequalities due to various factors that are across the globe, and these differs from one country to other. Now, how do we reduce inequalities? Now, at the level of breastfeeding practices differ across the globe again, and breastfeeding needs to be protected, promoted, and supported, particularly among poor and vulnerable groups, because that is the main source of nutrition, that is the main source of food for the baby, and it is the most secure and safe food for the baby. And it also promotes both mother's health and also child's health. Thus, we can reduce the inequalities, especially in vulnerable groups. And coming to SDG 11, which talks about sustainable cities and sustainable communities. Now that we have discussed all these 10 sustainable development goals, where we have seen, how, what are the challenges to be, and what are the goals that needs to be achieved. And now, sustainable cities and sustainable communities talk about breastfeeding mothers and babies. They should be feeling safe and they should be welcome in public spaces. Pregnant and lactating women require special support during disasters and humanitarian crises. And they need to have provisions like lactation rooms in public spaces, even lactation rooms in public transport, like in trains or railway stations or in airports or in flights also, where mother can nurse their babies. So all these public infrastructure facilities should enable the nursing mothers to nurse their babies. And that's how, a sustainable city and communities can be fostered through breastfeeding. And coming to SDG 12, responsible consumption and production, as we discussed, most of the production that happens is wasted, and due to lack of infrastructure and lack of transportation and lack of storage and lack of supply, most of the food is wasted. And we see, though we are producing more than 5 to 6 times than actually required, but there are still hunger deaths happening across the world. People are, living with hunger. People are dying with hunger. Now, by promoting, we can reduce breastfeeding, we can reduce infant mortality. Now, breastfeeding provides a healthy, viable, non-polluting, sustainable, eco-friendly, environment-friendly, and natural source of nutrition to the baby. Thus, we can achieve responsible consumption and production, because production is natural and consumption by the babies will help reduce dependency on other production process and demand for consumption. SDG 13 again talks about climate action. Now, when we are engaging in production and consumption and various other activities, we are creating a lot of gases through the production process, like greenhouse gases and pollutants and toxicants that are released into the air that are hindering the weather process, climatic process that are leading to climate change. Today, we are seeing a lot of changes in the climate. Seasons are getting disrupted. We see, rains in summer season, spring season, even seasons are getting disrupted. And we see different climatic changes that are happening. So that is all because of disruption of the natural cycle that is happening in the environment through emission of these greenhouse gases and various other harmful gases that is disrupting the atmospheric processes that are happening. So now, breastfeeding safeguards infant health and nutrition during adversity and weather-related disasters due to global warming, irrespective of what happens, in the external environment. As mother body itself provides, adequate nutrition, it is not affected by any adversity or weather-related disasters due to global warming, which is happening, which is very much evident today. Thus, we can secure, a climate action. Breastfeeding is an initiative for climate action, which can promote and achieve this goal, SDG 13. And SDG 14 talks about life below water. Now, when we are consuming water and water sources for our activities, for our production activities, for our various other activities, what about the life underwater? There is a life underwater, ocean. We have huge ocean around. Water, there is a marine life in the oceans, rivers, lakes, and other water bodies. When water is polluted, water is contaminated, the life below the water are also getting a lot of diseases, right? They are also getting contaminated with metals, chemicals, toxins, and when we are consuming them, we are also consuming those metals, heavy metals, and chemicals, which also alter our health and status of our well-being. So this not only destroys the marine life, it not only affects the marine life, and also leads to extinction of marine life, which affects the biodiversity, which also affects the ecosystems on the planet. So breastfeeding entails less waste than formula feeding. There is no wastage at all, right? And whatever the substitutes or the formula feeding requires lots of water, right? And for various processes. So there is no wastage here. By promoting breastfeeding, there is no need of any additional water requirements. And formula production and distribution pollute seas, affect marine life, and various other water bodies. Now coming to SDG 50, life on land. Now there is also life below the water, beneath, in the water, and also on the land. Now the land, due to energy production, we are using firewood, that is wood, that is happening because of deforestation, because more consumption, more demand for firewood and fossil fuels. We are cutting down the trees and the forests, and we are using more fossil fuels. Now, that is disrupting the natural ecosystems and also the environment, that is leading to climate change. Now, breastfeeding is environmental, ecological compared to formula feeding or other substitutes. Formula production places pressure on natural resources and contributes to carbon emissions, greenhouse gases, and climate change, as we have discussed earlier also. But by promoting breastfeeding, we can also achieve and promote the SDG 50, that is life on land. Now coming to SDG 60, peace, justice, and strong institutions. So now, when there is a huge demand and there is a huge gap between demand and supply, there is always this greater need for, meeting the needs for basic food, nutrition, and other aspects. So there can be social unrest and there can be other social order issues because there is scarcity and there is an issue of accessibility, affordability of meeting those needs. So breastfeeding ensures that human rights are protected because the rights of the child and the rights of the mother is protected through breastfeeding. And this food security is also taken care by the mother through breastfeeding. So breastfeeding is enshrined in many human rights frameworks. If you see the human rights frameworks, various human rights documents also, you see breastfeeding is a right. And national legislation and policies are needed to protect breastfeeding mothers and babies. And coming to last goal, SDG 17, Partnership for the Goals, the global strategy for infant and young child feeding promotes multi-sectorial collaboration and partnership for breastfeeding programs and initiatives. Like even in India, we have, breastfeeding networks of India, and we have, breastfeeding collective, and we have World Health Organization, we have UNICEF and various other organizations which are working towards breastfeeding promotion. And because we see the percentage is very less, not even 30 to 31% of the breastfeeding happens in India and across the world. The ratio of breastfeeding is still very less and day by day decreasing. That itself, creates a crisis situation in the future where baby is not nurtured properly and adequate nutrients and essential nutrients are provided to the baby. Now, use of other substitutes or formula milk or other, nutrients can hinder the process of development to reach the full potential. So it's necessary strategies, partnerships, collaborations, and there are also laws that has come up in India and across the world, and prevention and promotion of advertisements, especially, promoting formula milk or any other milk substitutes as alternative to breast milk. If you see any such advertisement, you can report to the Consumer Affairs or the concerned bodies so that we can take respective action on this through the legal process. So there is no alternative for breast milk, and it has been recognized and reiterated by World Health Organization, United Nations, and various governments of India. So it is our right, and we need to protect our rights for breastfeeding and ensure that the mother's rights and the child's rights is protected in all the ways we can. So by addressing these breastfeeding in various aspects of sustainable development goals, we can achieve these sustainable development goals by actively promoting breastfeeding practices. Now, breastfeeding thus becomes a crucial step for healthy child's healthy future and also promotion of maternal health, and is a central component of SDG 2030 agenda, right? It contributes directly, as we have seen, there is no goal that is left out of breastfeeding purview. And we can see the breastfeeding practices directly contributes to all the SDGs, right? We have seen poverty reduction, health, education, gender equality, sustainable production and consumption, and also partnerships. So breastfeeding contributes to all the 17 sustainable development goals. Increased breastfeeding is associated with an estimated, US dollars 302 billion in additional to global annual income. See, that is also an income, right, for the families, right? They are using natural breast milk to feed their babies. So that is also an income for the nation, right? And it is also one of the most effective nutrition interventions for reducing under 5 mortality, as we can also reduce infant mortality, because by breastfeeding, we are also not only providing essential nutrients to the baby, but also we are building the immunity of the baby, which can resist various diseases in the under 5 segment. And breastfeeding supports gender equality and workplace rights, how we have seen. And it also, breast milk has a minimal ecological footprint. It means that, basically no economical footprint or a minimal ecological footprint. By practicing essential breastfeeding practices, we can achieve these breastfeeding goals. And not only that, there are a lot of other benefits as well, like health benefits. We could save more than 9 lakh children under 5 each year. Because when we see the deaths of children under 5 years, because lack of proper nutrition, adequate nutrition, malnutrition, overnutrition, undernutrition, all these can be adequately addressed through breastfeeding, proper breastfeeding practices, and reduce infectious diseases and child mortality by fostering and by promoting breastfeeding, and lowering the risks of overweight and obesity. And it could also prevent around 20,000 maternal breast cancer deaths annually, because breastfeeding actually improves maternal health and also reduces the risk of breast cancer. And it also reduces women's risk of diabetes and also possibly ovarian cancer, as per various studies referred. And as we have seen, breastfeeding also promotes gender equality and employment by having adequate breastfeeding policies at workplace and promotion of breastfeeding at workplace. As we see, only 31% of 159 countries comply the ILO's recommendation for breastfeeding support at work. Still, there is a lot of awareness that is required. And hardly, even now also today, we can see how many places have lactation rooms or nursing rooms in public spaces or public, or shopping malls or, public transportation, and even, in public spaces also, right? And globally, 40.6% of employed women have statutory maternity leave. And that is also being promoted now. People are advocating for 180 days leave, and also maternity leave for both, as well as father as well as mother. Along with mother, father also should be granted leave, because to promote, support mothers. So maybe these initiatives can also support breastfeeding practices. And breastfeeding supports reproductive autonomy through birth spacing. See, when mother is breastfeeding, then definitely, mother is taking care full time the requirements of the baby. So definitely there is also a spacing that is maintained between the birth of 2 babies. So that will also help in healthy offsprings. And coming to, education also, breastfeeding is associated with an IQ increase. Various research studies say that a minimum of 3 to 4 points IQ difference is noticed with the infants who have been breastfed and who have not been breastfed. As we have seen so many benefits of breastfeeding, definitely there will be an impact of breastfeeding and not breastfeeding a child. That is also reflecting in the IQ of the child. And also, there is better cognitive development that is contributing to improve educational and learning outcomes. And it is also an essential component of early childhood development. The first 3 years are very crucial, and the next 2 years and the additional 1 year, the total 6 years are very crucial for the entire learning process development, which is a foundation for the learning process, and most of the brain development happens in the first 6 years. So when adequate nutrition, adequate environment is not provided to the child is going to suffer for next 60 years to the entire adult process because of lack of proper foundation on the with different aspects like nutrition or development. So it is very much essential that if we want our children to be productive, active, and having health and well-being for the next 60 years, so every parent should foster breastfeeding and foster such an environment that their children are protected, well nurtured in the initial 6 years, especially the first 3 years, the first 1,000 days of child. And coming to environment also, we have seen how breast milk is renewable and environmentally sustainable. It is quite natural. And breast milk substitutes, as we have seen, requires manufacturing, packaging, transport, and energy, and leaving a larger ecological footprint. And it can also get contaminated over processing or over delivery or transportation or even at the place of consumption. And what is the way forward? Now, we need to have a global strategy. Breastfeeding is central to every woman and every child. So every woman, every child global strategy is promoting early initiation of breastfeeding and exclusive breastfeeding for 6 months and continuation of breastfeeding for next 1.5 years and supporting breastfeeding during humanitarian emergencies and having global partnerships to strengthen breastfeeding initiatives through various organizations and government initiatives. So with this, I would like to conclude the breastfeeding, how the breastfeeding is, promoting the sustainable development goals and contributing to for a healthy planet. Because of paucity of time, and we have already overshooted our schedule, I am not able to take in detail, but any other context we have this entire week. Maybe soon we will come up with another session, maybe in this week or in this month, where we will discuss in detail on how breastfeeding is promoting various aspects of life on the planet. So thank you once again for your patient listening. And now this forum, the platform is open for discussion. Now, if you have any queries, you are welcome. You can unmute yourself or raise your hand and share your feedback or questions. I request everyone. Yes, ma'am.
Thank you, sir, for relating the sustainable goals with breastfeeding. So you were able to link every goal with the current topic, and actually the mother's health is also taken care of, sir, with breastfeeding. They also don't gain weight, they lose weight, and there are so many pluses. So you can keep on be going. Actually, the benefits will be so many. Okay, so thank you very much, sir, for bringing all this and sharing the sustainable goals also. Thank you very much, sir.
Thank you, ma'am, for your kind words. Anyone else would like to share?
Sir, feedback from for certificate.
Sir, it is a wonderful elaborative session, sir. In fact, the 12 points you have covered is really super, because the first time we are seeing this. Anyway, if you could share that notes to us, it will be helpful for us to again carry forward further. Thank you, sir.
Sure, sir. Thank you, sir, for your valuable inputs. We will also share you the notes to all the participants. You can also actively promote breastfeeding. This is a purpose of having this session, and we'll be happy to share further materials to all of you so that you can also be part of this wonderful initiative. Thank you. Anyone else would like to share? Feel free. We have come to the end of the session. So the registration form is active. You can just continue to fill the registration form. That itself is an attendance form to mark your attendance. And we will share your feedback through email. Those who have attended, you can fill up the feedback form and give your feedback on each session. We'll be sending you to registered email. We have more than 300 plus participants. but we see there are, around 150 participants on and off joining and going, around 150 to 200 participants who have joined till now, and we have seen, more than 138 participants who have marked their attendance right now on screen in the live session. So those who could not attend the session live in Zoom can also watch. We'll be sharing you the YouTube link. You can watch the full session on YouTube, and then you can fill up the feedback form. So because this is an initiative where everyone needs to take their own part and promote breastfeeding, we are giving this opportunity. Those who could not attend now, you can also watch. And within the next 24 hours, everyone are requested to fill the feedback form so that we can generate the certificates and issue the certificates in next 3-4 working days. Leaving tomorrow, we will start processing, and we request everyone to fill the feedback form by Monday, end of the day, so that we'll be sharing you after this session. We'll be sending you a feedback form through registered email. So those who have already watched, marked attendance, you need not do anything. Only just fill the feedback form. Those who could not attend in Zoom platform, you can watch it in YouTube, and you can fill the feedback form by Monday evening, end of the day. So we'll process all the data, and then whoever is eligible, whoever has registered, participated, will be issuing for them the certificates. So thank you once again for everyone for your valuable time and patience for listening to all the speakers today. I would also like to thank the chairman, Professor Patan Umar Khan sir of Helen Keller Group, for providing this wonderful opportunity, and also would like to thank my head of the department, Professor Dr. G. Krishna sir, and also the organizing committee, the principal, Dr. Armugam sir, and also all the resource persons who have today collaborated with us, especially Dr. A. Jagdish sir from Apollo Hospitals, and Dr. Payal Biswasu from Bangalore, and Dr. Deepanjana Datta from West Bengal, and all other resource persons, Dr. Anupama Reddy from Aryajanani Trust, for collaborating with us and delivering wonderful sessions. So today we had started the session at 10:30 and opened the platform for registration, and we have initiated the sessions with a welcome address delivered by myself, Dr. Ravindra, coordinator for this national seminar, then followed by remarks by all the resource persons on this occasion. They delivered their message, and then Professor Patan Umar Khan sir has also welcomed the participants. Then we had sessions. The first session was delivered by Dr. Payal Biswasu on mother's milk to sustainable future, lactation, breastfeeding, human milk banks and network. And the second session was delivered by Dr. Anupama Reddy, fetal programming, that is prenatal programming, creating an empowered human race. And the third session was delivered by Dr. Deepanjana Datta on the genetic blueprint of the first 1,000 days from womb to toddler. And the fourth session was delivered by Dr. A. Jagdish, why the first 1,000 days really matter, and first 1,000 days of opportunities for early detection and early intervention in neurodevelopment disabilities. Then the fifth session was taken up by Professor Dr. G. Sri Krishna sir on developmental disorders and overview. And finally, the last session by myself Dr. Ravindra, on breastfeeding, a way forward for securing a healthy planet and achieving sustainable development goals. So with this, we conclude today's one-day national seminar, which has been conducted online in collaboration with Department of Clinical Psychology, Helen Keller Institute, and DHC, Apollo Hospitals, and ApoKOS Rehabilitation Hospital, and Arya Janani Trust, and Institute of Human Sciences for Holistic Health. And I especially once again express my gratitude to all the resource persons and especially all the participants who made this national seminar a grand success with your participation, with your patience. So we request everyone, to those who have not marked your attendance, the form is still active. You can see seminar registration form in the Zoom platform. That is not accessible outside. So we request will be there for another 5 minutes. Those who have not completed, to complete the form and mark your attendance. And you will be receiving your certificates maximum in a week's time. So we'll be sharing you a Google form feedback link where you can provide your feedback on each session. Kindly complete it by Monday evening so that we can process in 2-3 days and we can issue you the certificates for this national seminar. Thank you once again, everyone. So we'll be waiting for participants to fill the registration form, those who have not filled, and rest can leave the platform. So thank you once again.
Very much, sir. Thank you, sir.
Thank you so much, sir.
Thank you.
Thank you so much, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you. Thank you.
Sir, where is feedback form we have not received, sir?
That will be sent to your registered email.
Okay, thank you. Thank you.
Now mark your attendance. There is a registration form in Zoom because you might be joining with different name, right? So we'll not be able to know whether you have joined or not. That's why we have a registration form in Zoom platform. If you fill that, we'll get the name also, corresponding details.
Last previous webinars, we have not got the certificates, sir, also.
No, we are issuing those who have completed. If not, if you are not completing, then it will see these are the difficulties. We cannot, do it in a case-to-case basis. So that's why you follow the instruction. If there is anything, you can get back to us with your details. There are also instructions on the website. You send you send your proof of registration and participation. We'll also look into it. And sometimes it is happening that people are attending for just half an hour, 10 minutes and asking for certificate. So all these things are there. We cannot discuss on open platform. You can just contact us, with all the details properly, and we will definitely help you. So thank you, everyone. Have a great day and happy World Breastfeeding Week.